Good morning, good afternoon, good evening, wherever you are joining us from. My name is Agnes Insofwa. I'm in Melbourne, Australia, and welcome to the first ever Women's Conference intended for people who are living with sickle cell disease and caregivers. And caregivers could be mothers, sisters, grandmothers, and any caregiver who's looking after somebody living with sickle cell disease. So this idea came about a few months ago when Shanta and I were just discussing how women take so much time looking after our kids, just making sure that they're okay in this fight against sickle cell disease. We realized we never really take time to look after ourselves, and in so many areas, you know, spiritually, financially, your mental health, your physical health. And so we decided that we bring this conference so that we bring experts to come and educate us on how well we can look after ourselves. So for those people that don't know me, my name is Agnes Insofwa. I'm in Melbourne, Australia. I'm the founder of Australian Sickle Cell Advocacy. It's an association that supports people and their families living with sickle cell disease. Our primary goal for us is, as you can see from the flyer behind, we are raising awareness in Australia because this condition is considered a rare disease. And we do that in two parts. We are making sure that the people that might be at risk of having sickle cell disease, or those people that are living with sickle cell disease, have the necessary information. For those that might be carrying the gene, that they get tested so that they make informed decisions. But for those that are living with sickle cell disease as well, to make sure that we are bringing information of the new therapies around the world and any other necessary information that can help them in their journey of fighting this condition. When doing so, we are providing education, of course, but also we are doing support groups, for the first ever support groups in Australia for people affected, where we just meet as families. Especially before the COVID, we used to meet face to face and just talk about how we are coping and any other issues that may come about. But also advocating for better things for people with this condition. You know, it could be scientific research. Right now, there's few scientists who are working on sickle cell disease. You know, a cure might come from Australia, and do not just rely on bone marrow transplant as a only cure at the moment. But also advocating for things like better medications. In Australia at the moment, we only have hydroxyurea, and we are hoping and trying to get in touch with different pharmaceutical companies so that the therapies that are available in places like America and Europe can also be brought to Australia. So that's our organization. We're just trying to do our best. We are a very young organization, officially just about 2 years. But before that, we used to do this on social media. So the moment that I realized that our child was affected by sickle cell, what I did for me was read. I read every day. I kid you not, I read almost an article every day about sickle cell disease. I was looking for that cure. And I went to social media, Facebook to be specific. But what I saw sort of depressed me. In my head, all the horrific stories I saw, I was just thinking that, you know, it's just a matter of time and my daughter will start going through the same. So what I did after a few months, I decided to open a Facebook page. I wanted to just post the good things. I would post good things that I read about sickle cell. Anybody who's been cured of a sickle cell by bone marrow transplant, I would look at the doctor who did the transplant, and I would track that doctor and make sure that I speak to him and tell him that, look, or tell her, this is what my daughter is going through. These are the complications. Can we do a bone marrow transplant at one point? I did that to the doctors in Australia. You know, I was sitting one day in my sitting room and I saw an article, a news segment on TV about a doctor who had done a transplant about one of the kids who had aplastic anemia. I contacted that doctor and explained again the story of my life. This is what I'm going through. Our daughter has these complications. Can you do a bone marrow transplant? And for us, fortunately, God answered our prayers. That doctor, we tracked her. She was here in Melbourne, and we came here about 7-8 years ago. And through that process, which is a long story, different medications and different things, therapy, we ended up doing a transplant for our daughter, and now she's sickle cell free, and she'll be about 2 years next year, sickle cell free. But that's my story, and this is not the story for many people out there who are being affected by this sickle cell disease. But even during that period, even now, when I think about it, especially the time that we're in hospital, you know, you tend to say like, God, how did I do that? and how are other women doing that who are actually going through. And some of them will actually know that there's no that possibility that their daughter or their son might be cured, like in our case. And that's why we brought this. For us, it's just to talk. It can do much or it can't do much, but I've realized for myself over the years, talking really is therapy, especially if you're talking to the people like-minded that are going through something similar like you. So I want to thank Shanta to bring this idea. It started off like a joke, but here we are. But I also want to thank you, all the experts that we've invited who are going to give different talks so that we can just know how to look after ourselves as women. I want to thank all the panelists, the caregivers, and the warriors on this platform for you are going to share your stories, and hopefully we can all learn how we can look after ourselves. And we do hope to do this in future again, hopefully face to face. And I'm hoping it's going to be a place that I'm passionate about, and that's Africa. Shanta, we can do this in Africa one day, where all us women who are affected by this condition can just be women and talk of the things that we go through and how we can help each other. So thank you so much for joining us. This is recorded. You can watch and stop and come back again and rewatch. And if you've got any questions, get in touch with me or Shanta. If you've got any questions to the experts on this panel or the warriors or the caregivers themselves, email us, and the details are on this video, and we intend to get back to you. Thank you so much, and over to you, Shanta.
Thank you, Agnes. Good evening, good afternoon, good morning, wherever we are. I appreciate everyone who's attending, and certainly the speakers for this evening's conference here in the U.S. conference. I, like Agnes, have children who live with sickle cell disease. I have 3 sons, and 2 of them live with sickle cell disease. The first child, my first son who was born, who's our middle son with sickle cell disease, the news was quite surprising because my husband and I certainly knew about sickle cell trait, and we knew that he had trait, but we did not know that my thalassemia minor and his trait would combine to produce disease. So we were quite surprised when we got the first diagnosis of sickle cell disease, and fortunately turned that surprise into a mission to really spread awareness, knowledge, and ultimately find a cure for this disease. And we started our organization, the Maryland Sickle Cell Disease Association, in 2006. My husband, Derek Robertson, and I are both co-founders, and we just wanted to make sure that there was a link to the sickle cell disease community from the research institutions, from government, whoever is a stakeholder in sickle cell disease. We wanted to make sure that the community was strongly linked to what was going on in that space. So we started our organization in 2006, and have had the pleasure to work with a number of brilliant people, brilliant providers, 2 of the providers on this call tonight. We've been very blessed in the care of our sons, but we know that that's not the case for everyone. And really, our goal is to make sure that individuals living with sickle cell disease have access to quality care. So that is the key. Quality care. And as Agnes stated, I did one of her SCD talks with Agnes, which was fabulous and fun, back in July. And we just started talking, and we were talking about how, as mothers of children who live with this disease, how we are just on it and made sure that their disease was well managed. But we fell a little short when it came to our own self-care. And that just led to a conversation. You know what? There are probably a lot of women impacted by sickle cell disease in this space who really don't take the best care of themselves. And that's just not physical care, but also emotional and financial and just total wellness. So that's kind of how we got here today. We really don't know. We're taking flight. The plane is taken off the ground with this adventure and this project. We really don't know where it will take us, but we are very, very happy that all of you are here this evening to share this journey. The how we're going to do it this evening is Dr. Sherney, Wanda Sherney, who will introduce herself, is going to give a presentation on self-care. I thought of Dr. Sherney right away when self-care came into the picture, because it was at the SCDAA, Sickle Cell Disease Association of America conference several years ago that I had the honor of attending one of her Heal the Healer sessions. And I have to be honest with you, I didn't know until that very point that, you know what, I'm not taking good care of myself. And if I want to be here to be around to see these people I love, then I need to take care of myself and put on my own oxygen mask, as they say on the flights. So it was only fitting that we asked Dr. Sherney to talk about self-care. So she'll start us off. And then we will have a presentation by Dr. Lydia Pecker, who is my son's physician. So I'm very honored to have her as well to talk about reproductive health across the lifespan for women living with sickle cell disease. And then we're going to round it out with Dr. Reverend Lorraine Brown, who we've done lots of advocacy work together through our organizations. She's going to talk about coping through spirituality, and she's just a wealth of information and wonderful and true resource for our community. So without further ado, we will get it started with Dr. Sherney.
Okay. So good day, because I don't know what time it is wherever you are. And I do, want to thank the organizers for having me and for thinking about me, Shantae, and thinking about Heal the Healer. I am a general pediatrician by training, and I have spent the last 30 years of my life providing outpatient care for kids with sickle cell disease at the Comprehensive Sickle Cell Clinic at Children's Hospital. And I think that one of my areas of expertise is disease education and also providing coping strategies. And I tell you about that Heal the Healer session, Shantae, that came about because I was at the movie theater and I had turned off my phone. And when I came out, I had 3 messages from people from Lynetta Jordan, from Kim Smith Whitley, and from Mary Brown. And I'm like, oh my goodness, why are these people calling me? And they were calling me because Dr. Frempong, Dr. and Mrs. Frempong had lost their son, Kwame. And, the whole sickle cell community was just in so much pain. And I think about the fact that I did a year of hematology and oncology, and I went to 9 funerals in a year, and I spoke at 3 of them. And I just decided that, this is not for me, because you had to learn detached concern. And I was really not good at all at detached concern. And it really made me, I actually sought some mental health support. And I think one of the most important things that I learned from Dr. Skirta, when I said to him, well, Wanda, when I said to him, Dr. Skirta, what am I supposed to do with all these feelings? And he would say to me, well, Wanda, the first thing you have to do is have them, And so I think that, when we're looking at taking care of any patient population, but in particular, taking care of patients with sickle cell disease, one of the things that I'm so happy about is that there seems to now be a focus on self-care, and one of the huge problems is that we don't have enough providers who are capable of or willing to take care of our patients. So we really need to make sure that they're taking as good a care of themselves as possible. So I think with that introduction, I'm going to share my screen so that you can see my slides, because I always use slides. Slideshow from beginning. So, I'm just going to say one other thing, and that is, as a pediatrician, I always, my focus was always on pain, because kids always hurt, And when I would tell the parents, your kids might be a little tired, they say, oh no, my kids aren't tired. They're wearing me to death just like their cousins and the other kids in the family. But then as I watched my patients grow up, I would see that fatigue would really set in, and that whole idea of I slept 12 hours and I feel like I need another 12 hours of sleep, and then I started thinking about how, it's part of that fatigue is depression, and so I think it's real, and isolation. So I think it's really important that we pay a lot of attention to self-care. For caregivers, because one of the things that we know is that sometimes the patient actually outlives the caregiver because of that stress, you know? And the other thing is that I'm a breast cancer survivor. And I think that number one, if I had been doing better self-care, I probably never would have gotten breast cancer. And then when I did get breast cancer, it really made me focus more on that self-care. So it was just kind of a learned lesson. And so most of what I have to say has to do with handling stress, because we know how big an impact stress can have on illness and on health in general. So I do want to share with you my personal stress management plan. And this is something that I put, and I'm going to share with you my toolkit. But this is one of the pages, and I wanted to start with this, and I wanted you to see how pretty it is. But you know, when it's on a PowerPoint like this, you can't really see the words. So I have the words to the side. And I don't know if I can move. Can you all see that you're sharing your screen? Can I move that out of the way? No, it just has to stay there. Okay.
That is unfortunately beyond my technological ability.
Yeah, and I had it on an earlier presentation too, so we won't worry about it. We'll just talk around it. But you know, and the way I do heal the healer is that I have everybody sit in groups, and then they talk about, you know, what is it that helps them to relieve stress? You know, what has worked for them? You know, or they might just talk about a stressful situation, you know, and just talking about things really helps you to work through things. And so then what happens is they choose a group leader, and that person then has to come to the microphone and talk about what the ideas that they came up with. And then the second group, when they come up, they can only mention things that haven't been mentioned before. So every year I get more and more things. So I just wanted to talk about some of the things that come up and some of the things that really work. But one of the things that a lot of people know about me is that I always describe individuals with sickle cell disease as snowflakes, because each one is different. And that, you know, the scientific term is phenotypic heterogeneity. But for sickle cell disease, it's just like really the case, you know, that you have people that do really well and you have people that do very poorly, and no one child has all of the health problems. And so that's a real issue for sickle cell. And I think that's also an issue for stress management, because something will work for you that doesn't work for somebody else. And so it's really important that you have your own prescription. And I think what Shantae mentioned is important. I think one of the first things you have to do is recognize that you have to manage your stress, you know? And then once you do, then you've got to get the energy to actually do it. Because if you're really down and depressed, then you really have to force yourself. You know, you have to get on that treadmill or whatever you have to do to get it going. So if you recognize that you have to manage it, and then if you just conjure up enough strength to start managing it, then it'll come much easier as you move along. So of course, the first thing that always comes up is prayer in terms of stress management. And so we have a whole talk about that. So I'm not going to talk anything about that. But that exercise, you know, getting that blood flowing, you know, I bought a treadmill and I get on the treadmill for a half hour. I try to see Tiana is on with us too. So I can't really lie too much because I talked to her a lot about some of my failures, but exercise is really important. Healthy eating, you know, it can just really change things. And one of the things that I've learned during COVID, my sister and her two friends and I, we get together and we do meditation on Sunday afternoons. And you can download apps, you know, that will guide you through meditation. And I think that it just really changes the way you feel. And I really think the next one is the most important one for me, and that is breathing. You know, just stop and take a breath, you know, and it helps you to not be reactive, you know, and if you just slow down and then breathe in through your nose and out through your mouth, you will just find a whole kind of calming sensation that is just really helpful. So of course, yoga, and you can do yoga apps, and my 88-year-old aunt does Tai Chi. You've got to get your rest. Aromatherapy is something that can really be helpful to some people, you know, and one of my patients is an aromatherapy expert, and we actually have a rest and relaxation room in our agency where you can get a massage chair and do aromatherapy, and different scents work for different things. Oh, I have exercised twice, so that must really be important. Taking a long bath or a hot shower, I think everybody knows, to kind of wash the day away, or, Calgon is the commercial about the showers. And of course, music, I have to clean up the kitchen and I can put on some slow jams and then I can just get it done much better. It's just much easier. So listening to music can be very helpful, and everybody has their own taste in terms of what they like. Reading inspirational books, reading humorous books. Humor is really important. The more you laugh, the happier you feel. So I think that's important. Writing down 10 things that you're grateful for. Sometimes if you just refocus, I think about it kind of as cognitive reframing. It's like you've got a situation and you're looking at it one way, and then you can kind of turn around the way that you look at it. It's like, well, this is my situation, but let me see, I have these 10 things that are really going well for me. So just actually physically writing things down is important, and celebrating your small victories. I remember talking to a nurse who took care of kids with spina bifida. And I said to her, my goodness, that must be such a stressful job. And she said, well, actually, Wanda, it really isn't, because what happens is when you can help these parents to make have a small success, it is so important to them. If you can help them to be able to feed their child, then that's so important. So really paying attention to small victories really makes a difference. You can wake up and decide to have a good day on purpose. I'm going to have a good day today, no matter what, and that can be helpful. And then drawing and painting and doodling and coloring are all kind of creative things. I know people have done this painting with a twist. I don't know if you've ever done that, but it's just actually putting paint on a canvas can really just make you feel better. Journaling, which is something I really have a hard time. That's something I really tried to get Tiana to do too, but it's kind of hard to get people to do. But journaling, especially positive journaling, can be very very helpful. I'm looking at the next one, which is humor and comedy and laughing, and those kinds of things just help to elevate your mood. Talking to a friend. Sometimes you don't even know, you're talking about it and you actually come up with the solution to the problem while you're talking and just getting your feelings out. And then again, talking to a mental health professional. And in our culture, a lot of times, well, I'm not crazy and I don't need to talk to a mental health professional, but I think that we're becoming more and more open to that, and I think that now you can do things online, and we have resources for individuals living with sickle cell disease that they can talk to a mental health professional for free online. And just owning your feelings, you feel a certain way, and that's okay. You have to accept your feelings. And if you're sad, then you have to once again accept that you're sad for that day, and then maybe the next day you won't be as sad, but you just have to acknowledge your feelings. I certainly have seasonal affective disorder, so now this is the worst time for me because now the sun is going away and it's getting dark at 5 o'clock. So just making sure you get out and get sunshine and get some fresh air. Visualizing yourself in a safe, comfortable space. My ancestors are from the Bahamas. And so we go there all the time, and I visualize myself just floating in the salt water that helps to hold you up, and that can be very helpful. Now, this is one I really don't want to share with Tiana because she already does it to a fault, but retail therapy. So that's something that always comes up, that you shop till you drop, and but you have to be careful with that one. And, this is one that the next one is one that I talk about a lot whenever I give a talk. I always talk about my dad, Charles Whitten, who founded the National Association for Sickle Cell Disease. And I frequently talk about the fact that I'm standing on the shoulders of my dad. And I think we all stand on the shoulders of our ancestors, and so sometimes I literally call on the strength of my ancestors. And, I wonder, when they were bringing us across the Atlantic Ocean in those ships, if I would have been one of the people who would have been strong enough to stay and not jump over the edge, or if I had been enslaved and being raped repeatedly, would I have been able to continue to live on so that I could be here, And I look at that And I say to myself, well, if they could make it through that, then I can make it through what I'm going through. So please, share some of your strength. And sometimes I even strike a pose in front of a picture of my ancestors with my hands on my hips and my feet spread apart. And it's like a warrior stance, and it actually just brings you strength. I know it might sound kind of funny, but that's what I do, and it really does make a difference. And I suggest it to you. And so if you look at my handout there, what you have at the bottom, well, I have all of those things that I've listed to you. And what you're supposed to do is put a check mark next to what you think might be helpful to you. And then if there are additional things that aren't there that might be helpful to you, then you add those at the bottom. And then the most important thing is that you have to get a refrigerator magnet and you have to put it on your refrigerator, because you have to do it, because none of these things are going to help you if you don't do them. And once you get started doing them, then you can feel the difference, and then you'll be able to continue to do them, So I think that is really important. And I'm looking at my time and I only have 1 minute left, but I'm going to show you. Now my slides are not advancing. What's going on? Oh, there we go. Okay. So I want to just show you a couple of things. Of course, that serenity prayer, everybody knows about that you can't, you work on the things that you can change and kind of let go of the things that you can't change. But this is something called a life balance wheel, and you can get it online. And what it does, you're supposed to rate these things from 1 to 10, and you can put the things that are important to you around the circle. But the thing is, once you rate from 1 to 10, like if something is a 1, it'll be way down here, but if it's a 10, it'll be up here. And then you connect the dots, and you're supposed to come up with a circle, because your life is supposed to be in balance. And if you have this really warped thing that doesn't look like a circle, then that means you have work to do in that area. Because if that area is important to you, if family is important to you, and your rating for family is way down here, then you know that family is something that you have to work on in terms of trying to make your circle complete. And then I just really, because my alarm is going off because I timed myself, and I just really want to briefly show you. Okay, so first I have to make this stop. Okay, so I want to show you stop laughing, Tiana. I want to show you my patient empowerment toolkit, but it looks like, can you see everything? It looks like some things disappeared off of it. Do you see a water bottle?
No.
That is so.
The water bottle seems to be missing.
Oh, okay. I didn't realize. Tiana is laughing again. Okay, so this is my patient empowerment toolkit, and it's a self-care toolkit, right? And so here we have the backpack to keep everything in, and this is the water bottle, and this is the thermometer, because we know that fever is an emergency in somebody with sickle cell disease. And this is the a pill sorter to help you remember whether you took your meds that day. You open up the Tuesday thing and say, oh no, I didn't take Tuesday's meds, and you take them. This is the interferometer that can decrease acute chest syndrome. And this is the blanket. It's kind of like that concept of when you're pregnant, you pack this bag so that when you get ready to have the baby, you grab the bag and you have everything in it. So this is the toolkit. And then I think a really good thing that I have in there is Hertz Nazer's coloring book, because when you're having mild pain, then sometimes distraction can be really helpful. And then now behind the pictures of everybody is the stress ball. And that's just to remind you that you have to take care of your stress. And then we have Dr. Carolyn Rowley's Healthy Eating Guide. And then we have helpful apps to help you take care of yourself. And then we have reflexology, which, I don't believe that if you press on somebody's foot, you can cure their kidney disease, but we know that reflexology, there are studies at NIH that prove that it can relieve stress and it can decrease pain. So because of all the problems with the opioid crisis, we need to look for everything that we can do to help relieve pain in sickle cell disease. And I put these in the toolkit because I think that the NIH and ASH has been distributing them to doctors, but I think we need to be distributing them to patients. And then because we don't know which patient is going to see which doctor. And then this is the most important thing in the toolkit, and that's the passport to health. And what I want is in terms of self-care, one of the best things you can do to care for yourself is to know your disease and know your body. So what you do is you record everything, your medications, your hospitalizations, all of your histories, so that when you go to see the doctor, you're an activated and informed patient ready to participate in client-centered care. And this is the Safer card that Stephanie Worth developed that's going to help us, I think, with getting better care in the emergency room. And this is the last slide. And this is just a little coping strategy that I came up with. Once again, I refer to individuals with sickle cell disease as snowflakes. And what I do is I give this little gift box, and it has 2 bags of herbal tea. And when there's a problem, you're supposed to open up the box and you're supposed to drink the herbal tea. And then you're supposed to figure out how you're going to solve the problem, whether you have to go to the hospital or start drinking more fluids, take a hot shower, whatever you have to do. And then when you resolve the problem, then you put 2 new bags into the little box, and you close it down and basically try to close your life in terms of sickle cell disease, and then wait until the next problem occurs so that sickle cell isn't always just at the forefront of everything. And that's, I think, especially helpful for young mothers who have just found out they have a child with sickle cell disease. And I'm doing this educational session and sharing all this information that can be so frightening. So that's basically my presentation. So thank you for listening, and I'm happy to answer any questions, or are we going to do questions and answers at the end, or I just went a couple minutes over.
That's okay. Thank you so much, Dr. Shani.
Okay, so self-care is giving the world the best of you instead of what's left of you. So I'm going to stop sharing. Okay.
Thank you so much, Dr. Shani.
Oh, you're welcome.
Thank you so much. I can admit, I think I need almost everything on that list to self-care.
Yes.
You know, I'm a mother of 4, plus a husband. And yeah, I do need a bit of self-care, and I'll take that note. I'm writing notes, and I'll go through this afterwards. Thank you so much. At this point, we have caregivers on the panel and Warrior. We are going to give the floor to Esther, who's a caregiver herself, and she's going to tell you about herself, just to give a testimony in terms of what this topic is all about and how she relates. So Esther from Sickle Cell Society in Ireland, I'll give it to you, please. Thank you.
Hi, everyone. In fact, after listening to Dr. Shani there, I was like, oh, wow. You know, that's so therapeutic. I'm already feeling, you know, the wellness.
Good, good, good.
Yeah. Thanks very much, Shanta and Agnes, for inviting us here today. My name is Esther, as already introduced. I'm the founder of Sickle Cell Society Ireland, a mother of 2 very strong warriors, and I have 4 children in total, and my other 2 children are boys, and my 2 warriors are girls. They're quite they're older now. They're between 21 and 17. No, 22 and 17. So you can imagine it's been so many years of, you know, battling with sickle cell and trying to support the children. As we're talking about self-care, sometimes indeed as parents or as carers, we tend to, you know, worry so much about our children and forget about ourselves. So if I look at my journey in Ireland, having come to Ireland at a time when sickle cell was relatively unknown and my children presenting as one of the first cases in Ireland, you can imagine all what I personally would have gone through, trying on the other hand to educate the doctors, nurses about something that they, you know, knew not. For some of them, it was just a brief textbook knowledge, you know, and it was so much stress, not just, you know, as a carer, but the fact that you're trying to prove yourself. Number one, you're coming with a condition that is not known in the country, and you're Black on top of that. So I've come across people saying, oh, go back to Africa with your disease, don't come and, you know, infect Ireland and all of that. So it was a lot of, you know, trying to educate people. And at that point in time, I never really thought about myself, not for one day, you know, until Agnes, you know, had this conversation with me, like, Esther, very exciting, you know, session is going to happen. Shanta is involved, you know, blah, 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 blah. And it's nothing about your children, you know, the condition, but about you. I'm like, oh, that's so interesting, because we hardly ever think about ourselves. So talk about coping. I've been through hell caring for my children because one of them, she's literally gone through, numerous hospitalization, like for 20 years of her life. All we've known is hospitalization. She now lives with a permanent partial paralysis, and at a point she was in ICU for a couple of admissions. I've been through times when I've been told, listen, we don't know whether she's going to make it. She's suffered multiple organ failures, name it. I can't even go into beginning to look at the whole complications she's experienced. At some point, the only thing that actually kept me going was actually my faith. This is why this topic is very important to me. I recall when my daughter was so sick, I had been introduced to the chaplain in the hospital, and everybody was just waiting. Maybe she could pass today, she could pass tomorrow, and all of that. I was, getting prepared for the worst, and but all I did was pray. All I did was pray. At that point in time, my eyes were just set on my daughter's eyes. I couldn't even as, little as moved away from her corner, without making sure that my eyes are focused on her. It was as if it felt like spiritually she was feeding from my spirit to stay alive. I couldn't, remove my eyes, not for a second, off my child. It felt like the moment I took my eyes off my child, she was going to die. And that was the last thing I wanted to believe, because I believed so much in God. I would pray, I would quote scriptures, I would sing, all of these things I would have been doing then, with my eyes focused on my daughter. Not even when I'm going to the toilet, I had to walk backwards into the toilet in her room with my eyes focused on her. I wasn't sure whether it was fear, but in a way, it wasn't fear. I saw it more as my faith, because the only thing that was left for me at that point in time was my faith, the faith that I had in God. And I believed that God was going to keep my daughter alive. And at the end of the day, believe you me, my faith, God showed himself. It worked for me, because even her consultant at that time said to me, listen, I'm a doctor, but God heals. You understand? So you can imagine when, things begin to happen that way and the doctor says, pray because God heals, you're beginning to hit, the walls. So all I had at that point in time was my faith. And to be honest, it's been amazing hanging on to my faith. It's helped me. It's seen me through very difficult times. And to round up everything, research has shown that, religious beliefs can help us cope with stress. But this is just beyond stress. It can actually bring dead bone back alive. It can bring a dead soul back alive. That's the kind of faith I have. So religion is so important to me. The God that I serve is so important to me. And so is this topic as important to me. So I don't know how much I have to say, Agnes, or do you want me to go into more? I just had to keep it around religion.
No, I think that's okay. You can come in next so that we can just go with the program. But your testimony is so powerful, Esther. And I'm sure most of us mothers here can relate. I myself can relate. When my daughter was going through a bone marrow transplant, I went through almost exactly what you're talking about, like literally looking at your child every second, just thinking that maybe something might go wrong. And again, it's not that you don't believe, you do have the faith, but sometimes you fail to, I didn't cry because I thought I was disappointing God until God spoke to me through a friend of mine who said, you know, from nowhere, my friend called when that thing came. I wanted to cry and I didn't cry. Then my friend called me and she said, you know what, it's okay to cry, because even God himself cried. And that's when I broke up, because I said, you know, God, I believe you 1,000%. My daughter will be cured of this condition. The transplant will go fine. I'm crying because of the unknown. I'm human, but I know you're going to take care of it. So I so much relate. And I'm sure other mothers here also relate. So at this point, for the next 5 minutes, we are going to welcome questions to Dr. Shani and Esther. If anyone has any questions, please, you can go ahead. Thank you.
Yes, I would like to ask a question to my godmother, Dr. Wanda Witten-Cherney. Since you've given us such a beautiful plan on self-care, I'm curious to know, scale of 1 to 10, how good of a job do you do in taking care of yourself?
Okay, thank you, my goddaughter, Tiana, for that question.
You're welcome.
And I would say that before my breast cancer, I was probably at a 3. And now I am maybe at a 7. So I am a work in progress, and we all are, you know, and once again, I just think it's really important. And you already know that we encourage each other. You know, I call and tell you when I'm on the treadmill, you know, and so I think it's good to have a partner, you know, and I think it's good, once again, to put it on your refrigerator and to actually do it and to feel the actual benefits. But thanks for the question.
Absolutely. Thank you so much, Dr. Sherney. You have certainly been a blessing in my life, and your toolkit and all of the wonderful things that you shared are certainly important, and we will make sure that we get everything posted so that everyone has access to that information. And Esther, thank you so much for your testimony. Very, very powerful. And I said to Wanda, I said, Dr. Sherney, I said, I really feel that at my age, I've accepted that there has been some trauma. If you are the caregiver of or living with this disease, you've been traumatized in some way, just by the sheer unpredictability of what the life brings, living with sickle cell brings. So this is wonderful, and I'm glad that Agnes shared with you, Esther, that this is for you. So we always put our children, our husbands, whoever's living with this disease first, and that's where we want to keep them. But this conference is for our healing. So I'm glad that she was able to get you invited and onto the conference to speak. So next up, we will have Dr. Lydia Pecker to give us some information, some very important information. I don't have daughters, but women's health is extremely important, and the younger we start taking care of ourselves, the better we age. So Dr. Pecker is going to share some information about reproductive health across the lifespan. And I think, Agnes, you have Dr. Pecker's slides.
So, the opportunity to talk about reproductive health across the lifespan in women with sickle cell disease is something to celebrate. And the reason it's something to celebrate is it's because women are living well into their reproductive years with this disease. And we know that in countries that have the benefit of advanced medical technologies and newborn screening, we expect, for example, in the United States, all children born with this disease to grow up into their adult years. And so that, I think we should always start with something super positive, and I think that's super positive and something to celebrate. So I call this reproductive health stuff good trouble, in honor of John Lewis, and also in honor of all my patients who are going through it. So what do we talk about when we're thinking about this reproductive lifespan stuff? Well, I study fertility, so what I think about is your eggs, and that's a little bit myopic, right? That's a little bit narrow, short-sighted. There's a lot more in our lives than our egg supply. But I wanted to start with this picture to help you think about sort of the reproductive lifespan and what may be going on in women with sickle cell disease. So. And forgive me, I have a newborn in my lap who has been sleeping contentedly and now decides to make a ruckus. what's important here is this y-axis is the number of eggs, and then the x-axis is age. And you see that girls are basically, infants are born with basically all the eggs that they will have, and over time that egg supply declines, and women get their periods sort of somewhere in here on this graph. And then there's a period of optimal fertility, a period of decreased fertility, the end of fertility, which precedes menopause by about 10 years. And then there's irregular cycles. And this is sort of like for an average person, right? And there's ongoing research about whether this applies equally to everyone, but we think it's probably about right for healthy women. What the newest research about fertility in women with sickle cell disease, and particularly sickle cell anemia, perhaps more so, we don't really know, but perhaps more so than the compound heterozygote states, is that it looks like fertility probably declines a little bit more slowly in women with sickle cell anemia than it does in healthy women. And so what I speculate with my red lines on this graph is what happens to the egg supply of a woman with sickle cell disease. Now, this doesn't account for all kinds of variables we'll talk about in a minute. But of course, what also happens to young women as they grow up is that they go through emerging adulthood, and they achieve adulthood, we hope, and they're developing and achieving educational, occupational, and personal goals. So there's lots of other things going on besides your dwindling egg supply in this time. And I think it's really important to acknowledge that. The other thing that's happening for young women with sickle cell disease is that as they age, we know that the complications associated with this disease and also the mortality rises. And so, you know, even though I focus on sort of when the decline in fertility happens, it's a much more complicated picture for young people with sickle cell disease, because they're not just reckoning with declining fertility, they're also reckoning with an aggressive disease that affects people unevenly and certainly unfairly. So what are the main things we need to think about across this reproductive lifespan? So menstruation is the first thing that I think about. And so the question is, what's the expectation for menarche in girls with sickle cell disease? And the answer to that question is that although girls with sickle cell disease may have delayed periods, we expect them to achieve menarche, and we expect them to have rare periods. And so girls who do not achieve menarche or who have irregular or absent periods should be evaluated, and nobody should just wave that away as sickle cell disease. This is not sickle cell disease, and other things need to be considered. I think it's reasonable to think that treatments that improve growth, so hydroxyurea and chronic transfusions, change your metabolism. And I think that it's reasonable to think that early treatment with either of those interventions might reduce the delay in onset of menstruation. And that's because we think that the delay in menarche, in getting your period in girls with sickle cell disease, is due to constitutional factors, meaning sort of your metabolism, not due to anything that's intrinsically wrong with your hormones. So what guidance should we be offering really girls even before they get their periods, and certainly their parents, when we think about sickle cell and menstruation? So, you know, the first thing is that for about a third of women with sickle cell disease, painful periods are associated with sickle cell pain. And women can actually distinguish between the two of those things, which I think is so astonishing and interesting. But it's important for you to share with your doctors, and for doctors to be asking as a marker of high quality care, when you get your period, are you being affected by sickle cell pain? Good treatment for that is nonsteroidal anti-inflammatories. In this country, that's ibuprofen, Motrin, Advil, all of those things. And for some people, starting that in the days before their period starts actually sort of cuts cramps off at the pass, and is probably a more mechanistically precise way to treat this than opioid medications. Though of course, if you have severe sickle pain, you still may require opioids. The other thing to consider is a trial of menstrual suppressing contraception. And I recommend progesterone only contraception for this reason. There's not great data to support this, but I think if your quality of life is being greatly affected by your periods, then getting rid of them and seeing how that affects your life is probably worth a try. So reproductive life planning is sort of the next step in the lifespan highway. Comprehensive reproductive life planning is a national Heart, Lung, and Blood Institute sickle cell guideline, but it's not really being implemented, I think, super well yet. I'm hopeful that in the next decade we can change that. Reproductive life planning for women and men is an opportunity to consider the ideal age for a desired pregnancy or parenthood, if any, plans for contraception and conception, to consider consider the implications of the inheritance of sickle cell trait or disease for their children, and an opportunity to pursue sickle cell trait testing in partners, and counseling as needed. It's also an opportunity to lay out or acquire the information you need about sickle cell treatment in pregnancy, and for providers to really provide education around approaches to pregnancy and sickle cell disease, because it is a high risk state. And so just as an example, this is from North Carolina, and this is an example of what a reproductive life plan looks like. And the website is down here for anyone who wants to pursue this at a later time. So what kind of contraception is preferred for women with sickle cell disease? So first thing, in the last decade, a number of my colleagues have really helped us appreciate that sickle cell disease at baseline is something that causes blood clots. And so the risk for blood clots makes us worry about some forms of contraception, particularly contraception that contains estrogens. So many of the most common forms of contraception can have a combination of estrogen and progesterone in them, but there are also a number of forms of contraception that only have progesterone. And I strongly recommend the forms of contraception, hormonal contraception, that only have progesterone in them for women who choose hormonal contraception. And the good thing about that is that progesterone only forms of contraception include the shot and the Implanon implant and the IUD. And so these are very highly reliable forms of contraception, which are maybe especially valuable to young women who have education goals and other things that they want to do in their life before they pursue pregnancy. And although I recommend progesterone-only contraception, and as do many of my colleagues and the NHLBI guidelines, in fact, estrogen isn't totally contraindicated for women with sickle cell disease. And so if the risks, for example, of becoming pregnant are greater than the risks of estrogens, we might give you a trial of something that contains estrogen. However, if you have a history of blood clots or migraines with aura, or if you smoke, or if you're overweight, then you really shouldn't, you absolutely should not use estrogen-containing contraception. So pre-conception counseling. So we make the logic leap that you pursue pregnancy. Again, I don't, it's totally up to you whether you pursue pregnancy. There's so many ways to live a meaningful life, but partner testing for sickle cell trait is really important, and getting the test right is the first thing. So, we know that it commonly happens that patients who are tested for sickle trait have this test called the Sickle Dex, and the Sickle Dex is not the right test. And so the first thing you need to make sure when you're getting that trait testing, which we think almost everybody should be screened with before they get or partners screened, if you already know you have sickle cell disease before pregnancy, is the hemoglobin electrophoresis is the right test. And then the next question is, do you have the right test? And has a person looked at it who knows how to interpret the test? And we see, and I'm sure anecdotally, you have heard stories of people having any of these things happen. So the wrong test is ordered, no test is ordered, or the right test is ordered, but it's interpreted incorrectly. So I always have my patients bring their partner's trait testing to me so that I can confirm that whatever they've heard is correct. And I encourage you, if you've already connected to doctors who care for people with sickle cell disease, this is a great way to make sure you're getting that hemopathy test interpreted correctly. The next thing for preconception counseling is about what you're going to do to treat sickle cell disease during pregnancy. I discontinue hydroxyurea in all my women who are pursuing pregnancy and who are pregnant, and I often, especially if they have sickle cell anemia, start them on chronic transfusion therapy, although there's not a consensus in the community about this, and this is absolutely a decision that's made in discussion with my patients. So it's not a unilateral indication for chronic transfusions. And we just, I haven't said this yet, but the novel agents are really exciting, but we just have no idea what to do with them in pregnancy. I don't think anyone's using them in pregnancy yet, but hopefully someday we'll have some data to guide us. In terms of treatment plans, it's also important to assess opioid and marijuana use, because there are fetal risks associated with both of these things, and your high-risk obstetrics doctor may be able to speak to this. We don't think, for example, that women with sickle cell disease children are at higher risk for neonatal abstinence syndrome than people without sickle cell disease. But we are learning more and more about the consequences of intrauterine opioid exposure. And I think that that's a serious thing and should be discussed. One benefit of chronic transfusions is that sometimes it lets us wean off opioids in a way that might be protective to a fetus, and certainly is good for the mama as well. Additional regimen modifications to consider: when you're pregnant, you can't take NSAIDs, your iron chelation needs to stop, and if you're prescribed a prenatal vitamin and you have some iron overload, I strongly recommend trying to get one that doesn't have iron in it, because you already have enough iron in your system. At the end of the first trimester of pregnancy or beginning in the second trimester, we start aspirin to help prevent preeclampsia, and pain management needs to be discussed not just during pregnancy, but also as part of delivery planning. So briefly, what to do if your partner has sickle cell trait or sickle cell disease. So natural conception, right, is that you can spontaneously conceive, and then the fetus can be tested with chorionic villus sampling, and options counseling can be provided as needed. And we're really hopeful that cell-free DNA, a blood test for fetal sickle cell disease, will be available in the near future. That would help with two things. One, it would make diagnosis possible much earlier in pregnancy. And the other thing is that the risks associated with chorionic villus sampling wouldn't be necessary to assume. So this is literally just a needle where they draw blood and test they isolate the fetus's DNA from your own maternal DNA. And then the other thing is, some people think like, well, my first kid had sickle cell disease, so my second kid can't have sickle cell disease. That's not how this works, unfortunately. Every time you roll the dice, it's an independent event. And so each pregnancy has the same risk of being associated with pregnancy. Artificial reproductive technologies have variable availability and variable appeal to people, but they are at this point a totally established intervention to help people become pregnant. There are profound financial barriers to using this, and then obviously it's not for everybody, but the technology to use implanted embryos that are tested for sickle cell disease prior to implantation, technology that's now 20 years old. So this is not a new technology, it's not an experimental technology, and it's one that I think that my patients don't seem to know a lot about. So we're working on making sure that this option is known to people. And of course, you can always complete your family through adoption, which has its own complexities and joys. So how long to try? So one thing is that Black women are at higher risk ability, and we don't know how to define infertility in women with sickle cell disease, but if you've been trying for more than 6 months and you have sickle cell disease, I would start talking to your doctor. And we should also acknowledge and treat the significant psychological consequences of infertility, just like we should treat the significant and psychological consequences of raising a child with sickle cell disease. So we worry in pregnancy because there are many risks to the mother, fetus, and then there are these treatment changes that I've discussed already. Just to briefly touch on what happens for the mother, there's of death, miscarriage, preeclampsia, eclampsia, and preterm delivery, and then sickle cell complications, particularly in the second and third trimester. You just think about your uterus getting bigger and bigger. There's less room to breathe. It gets more uncomfortable. Patients with sickle cell disease don't do well when they have less room to breathe and they're uncomfortable. And what do we know about menopause and sickle cell disease? Well, actually not very much. There's almost no literature on this subject, and it's a site of a real gap in our knowledge. There's no real literature to guide the management of menopause in women with sickle cell disease, but the estrogen used as hormone replacement therapy is different from the estrogen I talked about that's used in contraception. And so if you're having symptomatic menopause, visiting this issue with your doctor is certainly warranted, and a thoughtful discussion of hormone replacement therapy may be warranted. Women with sickle cell disease need well women care, right? So it's interesting, women with sickle cell disease seem to be at decreased risk for fibroids, and I think maybe they have lower rates of pelvic inflammatory disease because women with sickle cell disease present for care sooner than in the general population. That's a hypothesis that I have not yet proven, but that's good because pelvic inflammatory disease is the most common cause of infertility. all women with sickle cell disease should receive their routine GYN, so HPV vaccines, pap smears, and mammograms. Super important for everybody. And there's this issue around bone density and bone health. All of my patients are supposed to take their vitamin D supplements, and that's because we know that bone health can be really compromised as patients age with sickle cell. Exercise is tolerated, is probably reasonable, and being overweight, I mean, you've heard it probably, I hope, on all of the airwaves, turns out it's not great for sickle cell disease either. Finally, briefly, reproductive health in the age of cure. There are fertility preservation strategies. There are 3 fertility preservation strategies for women, and all are now standards of care in the United States. The first is ovarian tissue preservation, the second is oocyte preservation, and the third is embryo cryopreservation, which requires a sperm donor, either your partner or a sperm you can get from a sperm bank. And we know that the age that transplant, if you have pursued transplant, and your pre-transplant fertility assessments contribute to your risks of infertility after you're exposed to preparative regimens. That's certainly true for gene therapy as well. We just have much less experience with gene therapy. There are some safety concerns with oocyte harvest, and I think that the main take home here is that this should be performed in discussion and collaboratively with a team effort. Your hematologist, your anesthesiologist, and your reproductive endocrinologist all need to be talking to each other to keep patients safe. I believe this can be done quite safely for women with sickle cell disease, but it requires a little bit of thought and a little bit of care. So reproductive healthcare concerns, as many of you know, begin in pediatric care and continue into adult care. And we really need deeper comprehensive care systems to provide this care. And I think that the patients are going to lead the way on this by asking their doctors for more information and really insisting that this become part of their sickle cell care. Anticipatory guidance and physician-initiated conversations about menstruation, contraception, and pregnancy are certainly necessary for girls. We know that adolescents do not bring these things up to their doctors, but if their doctors bring it up, they're usually game to talk about it. And I'm part of a community of people who are pursuing research to help fill the many gaps in what we know about this topic. And of course, we will require patient collaboration to find the answers. Thank you to the organizers of this event and to all the people who support me in doing my work. And I'll take any questions you have.
Thank you so much, Dr.
Thank
Pecker,
you, Dr.
for that
Pecker.
informative session. Well, we'll just change the program a little bit. I know you've got the little one, you need to leave us for after a few minutes. So we'll take questions now before we bring in Tiona to give a testimony. To kickstart, we've got 2 questions to begin with. The first question that we've received is, should women continue to receive pap smears after the recommendation that is standard now? This is from Jay Jones. She's got sickle cell SS and she's 66.
She's 66. That's awesome. Pap smears for women who are 66. So I would ask your GYN. I actually don't take care of anybody who's that age. There's reflex testing that can be done when you have a pap smear to see if you have any HPV strains. And if you test negative for that, they space out the frequency of your pap smears quite significantly. So I would certainly see a GYN and certainly ask that question. Cervical cancer can occur, right? Pap smears are performed to screen for cervical cancer, which can occur in later life. So I think it's important to get the most up-to-date information from your GYN doctor.
Thank you, Dr. Pecker. There's a second question. What guidance would you give to young men with sickle cell disease who are sexually active? That comes from Audrey Williams.
That's a terrific question. And you know, just because I study women, it doesn't mean I don't care for my young men equally when I see them. I want to reassure everyone. but so young men, so first of all, fertility issues are really profound in men with sickle cell disease. So both sickle cell disease itself can cause injury to the testicles, which can decrease sperm counts. For some people that can be quite significant, for others not so much. And then hydroxyurea, at least while you're taking it, can also affect sperm counts. There's some data, I don't think we have a consensus yet, but there's some data that suggests when you stop hydroxyurea, sperm come back, which I think is reasonable to think may happen. But if you have injury from your sickle cell disease, that could persist even in the absence of hydroxyurea. What I tell my young men, first of all, is I ask them, just like I ask my young women, if they're ready to be parents, when they want to be parents. And if they don't want to be parents, or if I ask them what they're doing to prevent pregnancy. And if they do want to be parents, I talk to them a little bit about sickle trait in their partner, and we discuss getting their partner tested. For my young men also, we talk about priapism and erectile dysfunction, which are major issues for about a third of my patients. And usually we go from there. So you know, although I drive the conversation about reproductive health every time I meet a patient, it's also, I do that so that in follow-up conversations, the patients know that they can talk to me. And so for my patients who are men and women who are not yet pursuing pregnancy, I make them swear a solemn oath that before they pursue pregnancy, they will come back and see me with their partner so we can talk about how to do it safely.
Thank you, Dr.
One other thing about that, you know,
sorry.
in the pandemic, we're finding, sorry, I wanted to add, in the COVID pandemic, we're seeing rates of sexually transmitted infection testing fall significantly. And that's because people just aren't pursuing care. So, you know, I've taken this as an opportunity to test my patients if they wish to be tested. But I think it's something for our patients also, if you end up coming to care and you need that testing, you should just ask for it, because testing rates are falling, but that doesn't mean the infections in the community are falling.
Thank you, Dr. Pleca. I have quickly just two questions. Firstly, it's with preservation for sickle cell patients who undergone a bone marrow transplant. Do you have any data to show that at some point these patients do fall pregnant naturally, or do they have to just do the artificial insemination?
That's a great question. So we have very little data about this in women with sickle cell disease. We have some data from cancer survivors. Overall, I think it's reasonable to think that if you were reasonably fertile before you had your transplant, that you probably will have a fertile window after transplant, but that window is probably smaller than it would be for somebody your age who did not get exposed to chemotherapy. The other answer is we don't know for sure. So, you know, we just haven't followed patients long enough or systematically enough to have a great answer to that.
Okay. The other question I had is that, is there any research in mothers who are sickle cell carriers? I speak this from experience because I almost died when I was having my fourth child who ended up having sickle cell disease. And even though they told me that the diagnosis I had was something called Still's disease, all I had to go back when I went back to nursing school, I portrayed all symptoms of a sickle cell patient. Do you think there's enough research to look at sickle cell carrier mothers as well, or have you come across such?
At this point, there's not data to support the idea that women with sickle cell trait are at increased risk of adverse outcomes in pregnancy. But I think it's an open question, and I have learned, for example, that there is an increased risk of clot and kidney disease in trait carriers in the past decade. I'm hopeful that in the next decade, we will have some better answers about whether or not there are pregnancy risks. You know, the things that I would wonder about sickle cell trait affecting in pregnancy, Still's disease is pretty unusual. I'm not sure I would think of that necessarily with sickle cell trait, but I would think about and wonder about preterm labor, miscarriage, and preeclampsia. And again, at the moment, we don't have a reason to think that those complications are increased in women with trait, but the truth is really no.
Okay. Well, thank you for that.
I just wanted to say, Agnes, I'm sorry, before you introduce Tiana, thank you so much, Dr. Pecker. We really value your time. I know you have a little one there who needs you. And there were a few other questions in the Q&A. We can get those to you and perhaps you can reply by an email response. If that's okay.
I'm going to turn off my screen, but the sleeping. So I'm going to, of course, let Ms. Wolford, and I'm going to reply to these questions while she talks. Okay.
Thank
Okay.
you. All right, Agnes.
Thanks. Thanks again for having me.
Thank you so much, Dr. Pepper. Well, at this point, we'll have a testimony from one of our own who's become my little sister. I just need to fly her to Melbourne, this one. I'll give you the floor, Tiona, and give your testimony before we go into Dr. Brown's presentation. Thanks, Tiona.
All right, thank you, Agnes. So I really have become obsessed with reproductive health and sickle cell. I think all of you know that. And you know, I really was not thinking about my reproductive health that much until I had my bone marrow transplant, which was 10 years ago. And my hesitation for wanting to do that transplant came from my desire to have children. And I was so scared. I knew that there was a risk that the chemo and the radiation could make me infertile. And I said that to the doctor who did my informed consent. And I said, you know, I was just so worried about being infertile. And he looked me in the eyes and he said that I should not be worried about this process making me infertile because I was already infertile, probably already infertile from sickle cell. And, you know, I really didn't know anything about it. I didn't know whether he was right or wrong. So I took that and I went ahead with the transplant. And I heard from an endocrinologist that I really didn't have a lot of eggs and that by the time I was ready to have a family, I probably wouldn't have any. And so fast forward to a couple of months ago, I got a call from Dr. Lydia Pecker, who is actually my hematologist. We had tested some of my hormone levels and she said that they were pretty dismal and that I had to start thinking about preservation. So I went to the internet and I was looking for resources and I was looking for grants that would help me pay to freeze my eggs. And everything was for women with cancer. And so I remember emailing Dr. Pecker in the middle of the night and I said, what if I start an organization and I give away grants and I help us to freeze our eggs, especially for those of us pursuing these curative options? And she was super excited and supportive, but she said, I think we can do a little bit more than that. I think that there's more we can do. So then, and I just saw that Dr. Kim Smith-Whitley is listening, and that is so cool because I was going to be talking about her behind her back. I attended a conference and she did a presentation and it was about all these reproductive health concerns with pregnancy and contraception and menopause, just so much that I didn't know. And the three of us came together. And from all that pain that I went through, you know, I wanted to do something about it. So we are all coming together and we are starting our own organization and we will be addressing all of these reproductive health concerns because I think it does get overlooked. And we've had so many conversations about how we will talk about the pain and the fatigue, but nobody is really talking about reproductive health. So pray for us because nobody else is doing this and it's a lot of work, but I'm excited and I'm just looking forward to making a difference and to kind of filling that void and bridging the gap in the community for reproductive health.
Thank you, Tiana. And I remember, I don't know if you remember, but I remember us being on a flight from Atlanta, one of the SCDAA meetings in Atlanta, and we sat next to each other, and you shared your story with me from takeoff to landing. And so it's quite an amazing journey. And I appreciate you and just watching you blossom into this strong warrior for sickle cell disease. It's just an amazing to watch you just take on that role. So we look forward to hearing more about your organization. And I know somebody who's waiting for you to make that call so you can get more information about getting set up. I've already planted that seed on my end. So we look forward for more great things to come. All righty, so we have, last but certainly not least, on our for our speakers this evening, Reverend Dr. Lorraine Brown, who has been a friend to the Maryland Sickle Cell Disease Association, and she has known my husband Derek for many years, and they've worked together in the past, and she just always has very wonderful work, and we're looking forward to her sharing her information this evening. So Dr. Brown, if you could just give a brief intro, and then we will get your presentation up.
But thank you for thinking of me, and I'm really humbly honored that you're to be amongst all of you women and the work that you're doing. And there is no way that it's in isolation. Everything is working together. For 45 years, I've been a registered nurse, and most of my focus has been on enhancing community health. And in the early 2000s, I was working for the Department of Health and Human Service for the Genetic Service Branch, where I was the director of the hemoglobinopathy programs and project director for 2 sickle cell projects that were federally funded. I really truly believe that my community nursing experience led me to the call of ministry, and that has allowed me to focus on the body, the mind, and the spirit, and for achieving total wellness. So when I was completing my Master's of Divinity in 2014, I specialized in spirituality. And since 2015, I have become the director of Project Spirit, which stands for Sickle Cell Pastoral Intervention, Reaching Individuals in Transition. And this has become a multi-leveled project focusing on the influence of spirituality on young African-American adults, age 18 to 28, who are seeking, exploring, and questioning their spiritual development. This year, I was fortunate enough to have completed my doctoral work, where I worked with Lydia at Johns Hopkins, and I focused on the impact of spiritual counseling for African-American young adults with sickle cell disease. And this year, I also became fully ordained minister in the United Methodist Church. So it's been a really full year. Now I find myself in the midst of my first unit of CPE, which is for chaplaincy, which I'll be using in the creation of our next iteration of the Project Spirit community-based organization to continue work on spiritual counseling for young adults with sickle cell disease. I truly feel God has ordered my steps, first to the call of nursing and then to ministry, to facilitate healing and wholeness in individuals, families, and communities. So on that note, I'd like to begin with my presentation, which Shantae has my slides. And the presentation is titled, Coping with a Spirit of Hope. Kind of got the little pastor in me, but I'm not going to be preaching to you, but it does seem to, are you going to make the full slides? Yeah, thank you. Thank you very much. So I first wanted to just kind of do the learning objectives, which is to make sure to explore how women diagnosed with sickle cell may be impacted by spirituality, and to understand barriers that might exist for women diagnosed with sickle cell disease who might be seeking, exploring, and questioning what role spirituality may play in improving their well-being. So there's a fundamental and distinct difference between spirituality and religiosity. Religiosity involves both a personal belief, such as belief in God or a higher power, and institutional beliefs, traditions, and doctrines. It's corporate worship, where you go to a place or in fellowship as a community. And so a lot of times it's mainly about those outward connections. Spirituality is that usually describes personal relationships, those practices, purposes, meaning with God or a higher power without the need for the institutional beliefs and practices. It's an individual experience. It's mainly an inward kind of connection. There may be other people involved, but it doesn't require a body of people together. Spirituality involves gratitude and the ability to see the sacred in common things. It's often about a personal quest for relationship building. And for some people, spirituality may have a positive association for creating a personal experience with a higher being. And for others, religion has acquired a more negative association of hindrance to those personal experiences with a higher being. So it may be important to note that individuals who consider themselves spiritual may also be religious, while others who consider themselves spiritual may deny religious interest. So those who are spiritual can be religious, but but there are others who are spiritual and don't get into the religious interest. And so spirituality takes many different forms. And for the purpose of today's discussion, my frame of reference is spirituality, those personal relationship practices and meaning of God or a higher power, which does not require the need for institutional beliefs and practices, but it can. So why this focus? Because individuals may not be aware that spirituality, care of the mind, body, and soul, can be incorporated within holistic wellness, or even how to attain it. Spiritual coping and support has been found to assist individuals in dealing with chronic illness, and it's important for improving quality of life. And it takes an interdisciplinary approach, medical, psychological, and spiritual members of a team to assist individuals suffering with a painful disease to cope with the disease and improve their quality of life, to thrive, not just survive. The benefits of spirituality may serve to preserve health and can be an important element in the way individuals face stressful diagnosis and cope with future decisions. Spirituality can provide hope. Next slide, please. And then the next one. So what is hope? Hope is a gift from God. Life should be lived predicated on the knowledge that there is light even in darkness. Sometimes all that is needed for someone to have hope is someone to shine light where there is uncertainty. So the work of hopefulness is about sharing with those who may not fully understand a future full of what the higher power of or God plans for them. Hope is really about the expectation of God moving in one's life. So the absence of hope in one's life is to lack meaning and live powerlessly. Next slide. If the day-to-day is only about managing pain and racism and all the other tasks of just surviving day-to-day without hope or of change to anything of benefit, what's the purpose of life? Next slide. Maltman, he addresses the doctrine of hope as concentrating on the personal experiences of life in which we search for new beginnings and find them. These new beginnings often involve discovering the plans for one's life. Next slide, please. So when we're talking about hope, we're also talking about coping. And some of what Dr. Sherney was talking about is where this comes in. Hope involves the ability to cope. It's the ability to respond to problems, responsibilities, and stresses of life that interfere with the normalcy of daily life. Research has shown that by utilizing some of the same strategies that Dr. Sherney referred to, can become coping mechanisms and such disciplines such as relaxation, breathing, prayer, meditation, contemplation, devotions, exercise, yoga. They may help individuals better manage chronic illness and pain. And these forms of spiritual practices become part of how the higher being or God becomes known and witnessed in the world. It's when we take time to be still, calm ourselves, and really start going inward and hear from that higher person. We get that inner peace, even in the midst of pain. Next slide, please. The other aspect of hope and coping is resiliency. And it's an important aspect of coping because it's the ability, even in the face of difficulty, to function, adapt, and to basically manage life, even in the face of difficulty. Next slide. So as we go thinking about spiritual care is an aspect of where we respond to the needs of the human spirit when faced with illness. Spiritual care is assisting another to find meaning and self-worth and independence at a time when they might find themselves at an altered state and dependent upon others. When somebody experiences a health crisis, this becomes an opportunity to really reevaluate their relationship and life priorities, and becomes an opportunity to see things fresh through a spiritual lens. What is the higher power calling that person to do or become? Next. Spirituality in sickle cell disease is when within illness, illness can be a negative force in one's life. It can produce fear, anger, worry, anxiety, and depression, attributes which the body does not provide relief to the body, but rather becomes sources of spiritual deterioration. It becomes more of a dis-ease within the body, and it can put the soul in jeopardy. So spiritual well-being is important for some patients who must cope with all the pains, suffering, and stigmatism of sickle cell disease. Next slide. To highlight that, and I know these words are really small, but when you get the slides, you'll be able to see them better. There is a story in the Bible that's found in the New Testament book of Mark 5:24-34 about the woman with the issue of blood. And this is an unnamed woman, and her story of redemption and healing could parallel that of women living with the issue of sickle cell disease. In the story, this woman had a condition of hemorrhaging, which caused her to seek treatment from many doctors, spending all her money on healthcare. There was no cure for her disease, and as much as she may have wanted, she could not hide her condition. So according to Jewish custom, she was ceremonially unclean and therefore shunned, ostracized, humiliated, and shamed by her community. She was cut off from the community activities, including worship, and her condition was destroying her life. All she could do was try to manage her illness. This woman had knowledge of Jesus and had faith in his works. Her only desire was to touch the hem of his garment. This woman did not know what would happen, or even would she be permitted as a woman to get close enough to him. But she had to try, since she had already lost everything, trying to be made well. What else did she have to lose? Her issue, like sickle cell disease, was probably causing much discussion and debate in the community amongst the people and the physicians. And as much as she and they may have wanted, she and they couldn't hide the issues. It was destroying her life. All the woman could do was try as she might just manage her illness. But because she remained hopeful and spiritual, she was made well. Next slide, please. Spiritual healing, being made well, is a spiritual process that attends to the wholeness of the individual's triune nature of body, mind, and soul. And so Dr. Christine Polchowski states that although cure is not possible for any illness, there is always room for healing. Understanding that being healed does not mean being cured, but having peace can become a source of comfort, strength, and hope. She goes on to further state that healing can be experienced as acceptance of illness and peace with one's life. This healing is at its core spiritual. As a result of this woman being made whole in her wellness, she was no longer rejected, no longer living a label. She was made free. Spirituality can transform individuals who more often than not find themselves bound up by economic, health, and social injustices. Next slide, please. Often women may feel or be rejected by society because they do not meet a forced and unrealistic standard of normalcy. These are the same women who rise every day and struggle under the weight of bias, skepticism, injustice, poverty, and systemic disempowerment. These are the women who, when they look in the mirror, may feel less than. Next slide. Spirituality may be a source for removing whatever may bind or obstruct a person from experiencing a spirit of hope. And not just hope, but a liberating hope that can bring about meaning and order to one's life, which may, in of itself, be an act of faith. Last slide, please. I thank you for listening to me. And I found this could be a scripture that you could just take with you, whether or not you are a believer or not. But the scripture says, be strong and take heart, all you who hope in the Lord. Thank you.
Thank you so much, Dr. Brown. We appreciate those words and information on how spirituality plays a role in coping with this very devastating disease. I thank everyone. I believe that we have checked off all of our objectives for this evening, Agnes. Is that correct? I think we have finished.
We still have one testimony. Yes, we still have one testimony from Sakina.
Okay.
And we can open it up for questions after that. So thank you so much, Sakina, also joining us from Ireland.
Good evening, everyone. Good evening, everyone. Good evening, Agnes. It's a pleasure to meet everyone here, these lovely ladies. It's a pleasure to meet all of the sickle cell community, listening to us, online and on Facebook. Thank you. It's a very interesting topic, and I've been listening to what has been going on, the conversation that's been going on. So I'm just briefly going to run through speaking about my faith and sickle cell. I'm a Muslim, and really, if you kind of look at the general description of religion, it can be defined as a set of attitudes and beliefs that fulfill specific functions or roles in people's lives, such as providing frameworks of meaning and resources for coping. So that linking that to Islam, Islam generally is, Muslims believe Islam is a complete way of life. So that's a simple way of defining Islam. So linking that up to my belief in sickle cell. Firstly, I'm a mother of 2 children with sickle cell disease. I'm the project and fundraising coordinator for Sickle Cell Society Ireland. And what has brought me to, what has brought the interest in advocacy for sickle cell, of course, having 2 kids and having lost a younger sister to sickle cell and a nephew to sickle cell, it is a cause close to my heart. Now, when we look at Islam and sickle cell and how it affects my faith. So I'm going to pick up a testimony based on one of the times that my son was in the hospital. When your kids are in the hospital and they're sick, they've got a crisis, you just don't think of what you're going to do. At a point you're thinking, you're leaning towards your religion or your spirituality to help you pull through. And I'm going to link that to self-care that was being, mentioned by previous speakers in this webinar. It all kinds of, it all links up. And I'm also linking that to the fact that, being my son, having suffered paraplegia, and linking that also to the previous speaker on reproduction and sickle cell. So all of these are very vital. Now, for me, when my son was in the hospital for that amount, about 3 months, I think we were in the hospital for about 3 months, and they said to us that he wasn't probably, if he was going to come out, he was probably not going to be able to walk again, or if he was going to walk, he was going to walk with a limp. So he was in a wheelchair for that long. I don't even like to share this. It is touching, because you're looking at the fact that, okay, where am I going to draw the strength to move on from? So I had people praying over the phone, praying for my son, and I would sit down, with the imam, and we'll pray over the phone, put it in my son's ears, and he would listen, and I'll play the Quran, and just for illness, for him to get well. And I'll probably sit down and do Ya Salam, which is peace, and Ya Shifa, which is, healing. So those are the words that that kind of got me through when my son was in the hospital, to make sure that I'm kind of connecting to my spirituality as a Muslim, and also to the fact of the medical terms, because at that time there was a medication that was going to be used on my son, and it hadn't been used in any patient in Ireland. So they were saying to me that, okay, you need to give us permission, like really signing away our rights and our life, my son's life, in regards to that medication. And they said, well, they don't know if it's going to work or not, but they're just going to give it a shot. It's been used in the UK and it's worked. So they're just going to try. And I was like, I knelt down, I was like, oh God, this is the time. And linking that all up, I think being prayerful, and I suppose all of us have a means of spirituality, and how we kind of connect to the spirituality, on how we link that all up to our self-care to actually get us through whatever it is we're going through as carers of warriors, and how to actually pull through that. I would be fasting, and I know that would be something that would also be inclusive in one of the Abrahamic faiths, which is Christianity or Judaism, and as much as Islam, because there are 3 of them. So as a way, I would sit down, and I remember a lady came up to me, and she said she has just gone up to Cashel or somewhere on a pilgrimage in Ireland somewhere. She brought me salt. And she said to me, I know you're a Muslim, and I've seen you be praying, and be praying, playing the Quran next to your son, but can I offer you this salt? I don't know, it's up to you what you believe in. And she said she'd gone for a pilgrimage, and because her granddaughter was in the hospital and wasn't feeling well, and said, can you put the salt and give it to your son? And that's a different aspect of my faith as a Muslim. But nevertheless, I took the salt, put it in the water, because at that stage you're thinking, I just want my son to be well. You're not thinking if it is if it's okay, if it's salt or whatever. It's salt anyway. But then that didn't stop me from leaning towards my religion to help us go through the crisis my son was having at that time. And there are a couple of stuff linking sickle cell disease and Islam and the faith in it. Although evolutionary medicine uses Darwinian evolution as a heuristic for understanding human beings' susceptibility to diseases, this is not necessarily in conflict with Islamic medicine. So if you look at Islamic medicine as well, it should also be noted that current evolutionary theory was first expanded by various Muslim scientists such as Al-Jahiz, Al-Tusi, Ibn Khaldun, and Ibn Maskawawi, centuries before Darwin and Wallace. So in this way, evolution should not be viewed as being totally anti-ethical in Islam. So it is, you want to kind of link your faith, and you also want to kind of link the medicine, resources out there for us. So I know Sir Peter Candela in May 31 brought out a review where it describes how a mosque promoted public awareness about diabetes, but then linking that, they started promoting increasingly in the places of worship as as an effective mechanism for the provision of health education. So I know it's sickle cell disease is prevalent among Africans and some Asian communities as well, which takes the form of thalassemia. So it is important that we're able to kind of link our faith, spirituality, and how it actually helps us pull through situations that are difficult at times when we're dealing, when we have kids or families have issues with sickle cell. And I think my faith as a Muslim, regardless, has helped me to pull through, has kept me sane, because the hope and the belief that the prayers that you're praying to God every day is actually going to come through for you, for your child, because you're thinking, is your child really, is this going to be the last time? As Esther said, that you're looking back, you don't want to miss the minute that it happens. And it doesn't happen, but the faith actually keeps us going, regardless of whether you're Muslim or Christian. The hope of faith, and that's the link to the fact that there's something you believe in, and whatever it is that you believe in is what actually works for you. That's my belief. So linking that as a Muslim and that faith has actually helped me through to pull through at very difficult situations. I know we're way above time. I'm just going to leave it there. I just want to thank everyone. If anyone's got questions, feel free to ask. Thank you so much.
All right, thank you. Here we are back. It's the second week of the Women's Conference, a united front with different women from all over the world to talk about very important aspects of things that we don't talk much about as women. We have this idea between myself, Agnes from Australian Sickle Cell Advocacy, and we also have Shanta, who's from the Maryland Sickle Cell Disease Organization. We came up with this idea to bring women together to talk about healing, something that we don't do much. We are focusing on either ourselves as warriors or as women caring for warriors. So we thought we'd do this to just encourage women all over the world to actually look after themselves. So for us, we will just go quickly in the panel. My name is Agnes. Shanta would take a second or so to talk about herself, and then the rest of the people on the panel to introduce themselves. Then we're going to Jen doing a presentation about financial coaching, and then Rachel will join us later, who's doing mental health. So Shanta, over to you. Thank you.
That sounds awesome. Thank you, Agnes. I really appreciate this. This is our second week of taping. It's an exciting week. We had a great week last week where we talked about the importance of self-care, the importance of coping and ways to cope through spirituality. And also we talked about reproductive health in women across the lifespan. So today I'm really excited, like you said, Agnes, to continue our discussion on the importance of emotional and mental wellness, as well as financial wellness. My name again is Shante Robertson, and I am one of the co-founders of the Maryland Sickle Cell Disease Association, and I'm elated to be here today.
I think we'll start with Jen, our main expert on the panel today. Thanks, Jen.
That sounds perfect.
Hi, my name's Jane Walters. I'm a financial coach, and thank you for having me. It's talking about financial well-being is something that's I'm really passionate about, and I think that we tend to focus only on the numbers side of finances. So it's really good to talk about how that affects us emotionally as well. So I'm excited to be here. I'm based in Sydney in Australia, which is why my accent sounds like it does. But I'm happy to be here. Thanks for having me.
Well, thank you for that. I think without wasting so much of the time, we'll go into Jane's presentation, and then we'll do testimonies after the first one, or maybe two people will speak. Whilst we wait for Rachel, who's the mental health specialist, to come after as well. So Jane, you should be able to share your screen. If not, I'll give you, are you doing a PowerPoint or are you just talking?
Yeah, I've got a PowerPoint presentation, but yeah, so I'll try and work out the share screen.
Okay.
Go from there. Let's have a look.
So there's a share screen on the bottom.
Okay, I think now, oh, can you see that?
Yes, that's
Yes.
great.
Okay,
Perfect.
awesome. Okay, so as I said before, like, thank you for having me. And financial wellness, which is a bit more of a sort of holistic term, I guess, is something that I'm really passionate about. So I'm really I'm really honoured to be invited along here today. So I obviously don't have a great deal of time to go into any depth on this. So there's, if you do want to know more, then reach out. But I did want to sort of cover sort of the general sort of pillars around what financial well-being really means. So as I've got my screen on the other side, which is why I'm going to flick over to the side every once in a while. But I'm not going to spend a great deal telling you about me, but I'm going to spend more time probably just diving into what I consider to be those pillars of financial wellness, and hopefully give you a couple of practical sort of tips and tools that you can actually go away with as well, and then, you know, find more information out if it's something that actually interests you. So this is a very outdated photo. Obviously, I got my hair cut off, but that's me. As I said, I'm a financial coach. So I used to be a financial planner, and actually I've spent most of my career in financial services. And when I was a financial planner, I really noticed how there was a component that was really lacking in that world, and that is the acknowledgement that we are emotional beings, that how we do things is impacted not only by what we should do, but also what our thoughts and feelings and emotions are. And when we ignore that, then I don't feel like it's the whole piece. And so my motivation of moving across from financial planning was really to financial coaching, was really to help women specifically on a more sort of holistic basis. I'm also a mother to 2 young kids and a wife, and I live in Sydney, as I mentioned before. So with the actual definition, I think some people have different definitions of what financial well-being is. And so I just wanted to talk about how I see it. And it definitely includes the practical elements of finance. So I don't dismiss that we need to deal with the numbers, because the numbers are really important. But it is a lot more holistic than the way that we currently look at money, I think. So it's about, a lot of it is around having the emotional freedom around your money as well, and having a peace of mind and a trust that you will be looked after, and a trust that you will be able to manage your money, and that there will be things and people and forces there to support you as well. So financial stress and anxiety is kind of the opposite of that. So when people are in financial stress, it has significant impacts on their lives, and it affects how they feel about themselves and their lives as a whole. But it also impacts their relationships because of the stress that they have, and they become more distracted. They take more sick days from work often, and that any chronic stress has been shown that it has a really, it's a physical impact on the body, not just an emotional impact as well. And there was actually an interesting study where they found that when people were in severe financial stress and financial hardship, that they found that the experience of that was it actually then lowered people's IQs. So whereas some people would have originally thought, oh, they're under financial stress because they have a lower IQ, it's actually the other way around. And so when we enable people to have more financial freedom and to make sure that they are financially secure, then it has ongoing benefits across all of society, not just with the individual as well. So, and I will also note that, like, at this stage, my personal view is that the responsibility for people having financial well-being is something that needs to be addressed like on a government and corporate and community level. But today I'm going to really focus on the individual level, not because those others don't matter, but it is because that's something that we can actually control. And hopefully I'll give you a few pointers along the way that you can sort of apply to your life as well. I see true financial well-being as being supported by three main pillars, and that's self-awareness, taking inspired action, and also having support or having a support network in being able to make the changes and support yourself in your finances. So I'll go into some of these in a little bit more depth. And of course, I forgot to mention, if anyone has any questions either along the way or at some point, just let me know. So I think when I first talk about self-awareness, it kind of throws some people because they think, oh, well, what's that got to do with money? And they kind of assume also that they know themselves. You've been living with yourself for your whole life, but it's really about uncovering a lot of your thoughts and feelings around money and what I refer to as your relationship with money. And I think probably, having a relationship with anything, it's not just around, you don't just have a relationship with a person, but you can have a relationship with food or with work or with money. And essentially all it means is that it's all about how we think and feel and what we believe about money, but also what we think and believe about ourselves in relation to money as well. So I kind of see your relationship with money as being kind of a complex web of thoughts and beliefs and feelings. And for that reason, it tends to be something that's not necessarily obvious. There are some things that might be obvious, but the reality is that a lot of these thoughts are in the subconscious part of our brain. It's kind of hidden in a more sort of primitive part of our brain. And that part of our brain is a little bit like a computer hard drive, and it gets programmed, I guess, through all of the different experiences that we have through life. And it's an amazing system because it means that we don't have to think about things that that we have to do so repeatedly. But those patterns can often be supportive in our life, but there are some times when those patterns and those beliefs don't support us, especially if we're sort of making decisions around money, or we are spending or earning money. And we really have to sort of dig a little bit deeper and ask ourselves questions around, okay, where did these beliefs come from, and are they true, and do they sort of support me? So I guess as a bit of an example, like a lot of people grow up with this money doesn't grow on trees, and it's done from various different other kind of sayings and messaging that we get from our parents, all because they love us and they want to instill like values in us and that kind of thing. But it can then sometimes in later life end up leading to this idea that money is scarce and it's hard to come by, and that we have to struggle to get it. And interestingly, this is especially true for women, because it actually wasn't that long ago that women weren't even legally able to to hold money or to have a bank account in their name or to have a mortgage, those type of things. And so that sort of, those beliefs kind of can be construed as being, oh, you're not good at money, or you're not responsible with money. And so then there's a fear around money as well. Probably one of the beliefs that I hear with all my clients is that they say, I'm just not good with money. And I think that belief can really hold us back, because being good with money is a skill. And if you've learned any other skill in your life, you can learn how to manage your money. It's about sort of removing that belief and saying, actually, you know what, I might try and fail, but I can learn and keep learning and keep learning, and having a bit of a growth mindset around it is really important when it comes to learning any skill, but especially around money as well. So, you know, making sure that you have awareness about what your patterns are, and then also working to sort of change those as well. And changing those doesn't sort of happen like overnight. It's something that you need to explore and then understand where it comes from to kind of break it down. And then also deciding on purpose what kind of beliefs you want to have and the thoughts that you think will actually support you in, you know, creating that life and creating the financial means for you to support your life as well. So the second pillar is action. And this is where I guess the more practical elements come in. It's about taking the action that you need to take to make sure that your money is that you're earning money, that you are budgeting your money, that you are investing your money, how you're spending your money. This is about taking action from an informed and inspired place. So I always sort of think that creating a sense of financial well-being is that sense of knowing you have enough, that you have enough to look after yourself and the people you love, and to have the lifestyle that you want. So before I'm going to go through some of these key sort of aspects of managing your money. But before I do, I wanted to run through a bit of an exercise. And if you, I don't know, hopefully people have a pen and a piece of paper. And if you don't, then it might be something that you might want to come back to at a later stage. But one thing that I say quite a lot, it probably gets a bit repetitive. I always say, know your numbers, and knowing where you are, like where you are financially, actually can empower you then to make good decisions that are going to support you. So there's two numbers that we're going to just quickly run through today. You can go through these in a lot more detail, but I think even just writing them on a piece of paper to get an idea is really important. So the very first number is your net worth. And essentially your net worth is how much assets you have, and then minus any of your liabilities. So on that piece of paper, just quickly write down on one side all of the things you own, and that could be if you have a house, that could be the value of your house, how much is in your bank account, any kind of assets that you are sort of sellable, that then you can actually work out how many assets you have. Then on the other side is to write down any of your liabilities, which is basically debt or anything that you're owing to other people. So that could be, again, like if you did have a home, then it might be the mortgage on your home. And after it could also be a car loan, it could be a student loan, those kind of things. And essentially, once you've tallied those up, you have your asset number and you minus the liabilities number. That then brings you to what your net worth is. And when it comes to your net worth, it's important not to compare yourself to what other people's net worth is, because there's always going to be like a Bill Gates or a Beyonce or anyone else that's got a lot of money. And for us to compare to them or even the people around us it's not supportive. The reason we want to know this is so we can see the trajectory of that. So we can say, are we building our net worth? Are we actually getting to a point where we can actually say that we have this pool of assets that is hopefully positive and hopefully will then support us in creating the life that we want and creating the security around that. So the second number that is important is to know your cash flow. And essentially your cash flow, and I think not everyone will have this at hand, but unless you've got a budget, but it's essentially how much you earn minus what your expenses are. So you could look at your annual cash flow, or you could look at your monthly cash flow. And this is the point where understanding that a negative cash flow means that it's going to have a negative impact on your net worth position. And having a positive cash flow surplus means that you can then contribute to investments or to savings or to paying down debt, so it has a positive impact on your net worth. So those two numbers are probably the two most vital numbers that you can know, because it gives you a bit of a health check as to where you are from the financial point of view. So how healthy your finances are, and being able to look at that and look at that in an objective way as well. This isn't kind of an opportunity to say, oh, I'm so bad with money, or I wish I'd done something different, or any of these often negative self-talk that we tend to have around money. Is to actually say, this knowledge is power, and I can then make decisions based on knowing these numbers.
Jane?
Yeah.
Pardon me, hi, this is Shantae. I have a quick question.
Yeah, sure.
If you are, because the sickle cell community is very diverse in socioeconomics, if you are a person who has been unfortunate, not been able to keep steady employment because you're managing a very challenging illness, and you've just really had a tough time, where do you start? I believe in people, in meeting people where they are. So if you're talking to a person who struggled financially and really does not have a lot of financial knowledge, how would you say, what would your best advice be to that person in just getting started as far as learning and just understanding the basic principles and behind what it means to manage whatever amount of money you have? What would be your best advice? So a person seeing this webinar who might be in that scenario, I don't want them to walk away thinking this is too big for me, or this is not something for someone like me, where I may, have lost my job several times, or find it challenging to hold on to my employment because I'm trying to also manage this very devastating disease.
Yeah, and I think with this type of thing, it still, I think it applies at any level, and like whether you have lots of assets or whether you don't, or even if there's not if you don't have a regular income, that's where I think knowing your, so for example, your expenses is really important, and knowing how much you, at least from the very basic level, need to cover. And having that awareness of saying, okay, these are the things, these are my basics, these are what I need to cover. Like on the months that you are earning, to say, let's make sure that we can maybe keep some aside if that's possible, to know that in the future there might be months where you're not working. And so then that's really less about looking on an annual cash flow basis and more like bringing it down and saying, how much do I need to make sure that I can pay to live, essentially. So I think this still does apply at every level, because having that knowledge then enables you to know, look, actually, is there social security that I can go and get, or is there some kind of insurance scheme that I can tap into? And at least knowing your numbers, you go, okay, this is what I need to live. And if I can't do that, if I'm not getting it from paid employment, then let's look at where else that money might be able to come from as well. And that's also where knowing with your cash flow, if you, in the good months, like if you have a surplus cash flow, which is basically that you have more money coming in than going out, then you can contribute that towards an emergency savings account that you can dip into when you're not working, or if you get ill, or those type of things as well. Does that make
Yeah,
sense?
no, that's awesome advice, because that allows a person in this situation to know how important it is to plan for those periods when you might be out, might be out of work. So that's great. Thank you.
No, you're welcome. And I think that not having the knowledge is really powerful, because if you don't know what your situation is, then you can quite easily get into a situation where you're going into credit, into like large amounts of credit card debt, and you're not putting money aside. And often what I find working with some of my clients is when they do have variable income, whether that's because they work on a casual basis or whether they have their own business, they see a great deal of money come in and go, oh yes, we've got lots of money. I can use that money to go and do all these amazing things. But then it's sort of a boom and a bust situation, because the next month they've got all these expenses that then they didn't account for because their revenue from their business or the income from their work isn't as high. So having the knowledge of where you stand means that not only from a financial point, it's like smoothed out, but it's also from an emotional point of view. It means that you don't go into, depths of anxiety and depression and overwhelm. And also knowing that it just sort of then informs. I mean, if you're at a point where you're like, oh, I don't even know what my expenses are, then that sort of points to this sort of, I guess I kind of see this as a bit of like a menu, so to speak, where it's like, okay, what do I need to focus on? At the very base of this is like looking at a budget, even if it's a basic one, or using an app or something like that. Or once you've got the budget and you see that there's a deficit, which is just more money going out than coming in, then it's like, okay, I need to either look for more employment, or I need to ask for a pay rise, or find the money from somewhere else. So that knowledge then enables you to make these decisions about whether I, use extra money to pay off debt, or whether I build up my emergency fund. And all these different types of these kind of areas are all going to be very individual. And that's one thing I also stress, is that personal finance is completely personal. And so not two people's situations will ever look the same. And again, that's where the emotional part comes into it, to understand and manage your thoughts and feelings around that, and say, I'm doing the best that I can. And when I have the knowledge, I'm able to do even better. And finally, the final pillar is around having a support network. And I can't stress how important this is, because I think those feelings of anxiety and overwhelm can be massively reduced when you share them with other people. And it's completely, I've kind of got my suggestions here, but it doesn't have to be paid. Of course, I think getting a coach is amazing, but also just speaking to a friend or a family member who understands, who might be able to help, to have a regular money date, to talk to your partner about the situation that you're in, and how you're going to manage your situation together. And so support can come in many, many forms, but it's super important. It's super important. And I'm sure you would sort of know that through the sickle cell community as well, as how much support you get emotionally, as well as like from a physical point of view of knowing the steps to take and being able to manage your emotions around it as well. There's also a lot of free resources available on the internet as well. Great books and podcasts as well that talk about money, and you can educate yourself around money. And I have a blog as well, if you want to go and check out some of those articles. But the point is that you don't have to do it alone. And, humans are, we have evolved to become, well, we are very connected and emotional beings. And I think having support will make, not only help you make the improvements quicker, but it also makes it a much more a happier journey. And that's what real financial well-being is about, is around making sure you've got all of those 3 pillars in place to build that secure financial well-being. So I should probably wrap it up because I know I probably went a little bit over time, but are there any other questions? And that's me, if you want to get in touch.
Thank you, Jane. If you've got any questions, maybe we'll open it up just for 5 minutes question, and we have other people that have joined us a bit later that they can introduce themselves before we go into one patient, I think one or two testimonies before we go into the mental health session. So any questions, Tiona?
I just wanted to ask Jane, is the blog on your website?
Yes, it's under the tab money tips, and there's a whole range of different kind of tips and tricks, and it's both, as in it's both the emotional side of things and the practical side of things as well. I also, if anyone is interested, I have templates, which I don't have on my website, but budgeting templates. If that is helpful to anyone, I can always make that available to anyone as well. Just reach out and let me know.
Definitely want a template.
I was just about to say that, you know, making a budget, like how can you stick, any tips that you can give in sticking to that budget? You know, once you do have the intent, but then you see that as you go along, maybe during the month or the week, you sort of go off your budget. What tips can you give to actually stick to that budget? And if you don't, what can you do?
This is such a great question, because again, it leads back to the emotional element as well. Like knowing why you're setting up a budget. And I always like to say that I have a budget. I'm not on a budget. It's not something that's being forced on me. It's something that I am choosing to do because I want to support my family and I want to support my longer term goals as well. So understanding that you're doing this to support yourself can actually feel really good. And then when you're making decisions about spending in any moment, it's really thinking back to say, you know, is this supporting, you know, the present Agnes or the Agnes in the future? And to say, you know, actually, you know what, present Agnes wants this and it's important and it aligns with my values and my goals, so I'm going to buy it. And then release guilt over that. Whereas then, you know, oh, actually, you know what, I don't really want this thing that much. And I'd rather be working towards my longer term goals of reducing my stress and anxiety or building a business or whatever your goals might be. So that's one way, but also on the practical side is monitoring it. So there's lots of great apps out there where you can link your bank data or data in America, where it will actually come into your phone and tell you this is what you've spent. And you can even go in and put a budget in if you really want, or it can say, look, based on the trends, we're expecting that you're going to have to pay, you know, a $50 phone bill and $100 whatever the different things are, because it can track or it can give you a bit of a forecast about what you're expecting. So, you know, you go into your bank account and you go, oh, look, I've got, you know, $500 there, but then thinking, oh, that's actually going to last me for the rest of the month and I've got to pay $300 in bills. You can then make those decisions appropriately as well. So again, bringing the two sides of the emotional and the practical together.
Okay.
Jane, you made an excellent point throughout all of this. The main thing I heard was that financial knowledge is power. So wherever you are, having the knowledge of your finances is certainly very, very important. And I would imagine it's also very important to start very young. So start to educate our children very young on money management. So
and that's
certainly
points
that you made.
Yeah, and that's why I also love supporting women as well, because I think women already have so much power as mothers. And I think that when women have more money and more financial security, actually the whole world will benefit, because we're kind of in a point where we need to balance out that masculine, feminine energy in the world. And so time for us to step up.
Yes. Well, thank you so much. Thank you. Thank you, Jane.
Thank you for having me.
I think at this point, Shanta, do we bring in two people maybe to just give a bit of a feedback or testimony about their experience? But before we do that, we had people who joined in late. We have Natalie, Esther, and Mwanza. Would I just give you 30 seconds to introduce yourself, and then we'll go into a detailed testimony from Mwanza and Esther. Then we'll go into the mental health presentation. So I'll start with Natalie.
Hi, everyone. I'm Natalie Kapuya. Lovely to see some familiar faces on the webinar. I'm very happy to be here. Apologies that I was a bit late. So I am the board secretary of ASCA, but I am also the parent. I am a caregiver to a sickle cell affected person. And as some of the people working this journey know, it can be challenging, and having platforms such as these ones is definitely beneficial in terms of not empowering not just the caregivers, but also the people who are affected. And just one more thing, won't be too long. Thank you very much, Jane, for this. This was really great. Just one question that I want to have. How can we have some of this financial literacy in easily consumable form so that it can actually be shared with a lot of our members? Because a lot of us all over the world are, in different spaces and have access to different resources. So it would be nice, if the rest, the rest of the people can also have access to this very valuable information. Thank you.
Yeah, I mean, as far as like I can provide the presentation, but also pointing you towards my website. Like on the blog section, like I've got lots and lots of different articles on there about sort of looking at your budget, starting a budget, reviewing it, some of those practical elements, but also some of the mindset stuff as well around understanding your motivations behind things and managing your beliefs and thoughts around it. But yeah, there's also lots of other resources as well. And I might have a think about maybe putting together a list where you can sort of suggested reading and podcasts and those type of things as well, if that would be helpful.
Yeah, I think that would definitely be helpful, because I'm just thinking maybe at the people who probably have the lowest of the resources, that, even talking about a budget might be very far out, because some people are managing even, how are they going to eat and still have to manage with, some challenging circumstances.
Yeah. And I think with a budget, it doesn't have to be complex, but just having awareness around what you're actually what it costs you to live. Because if there's no awareness, then when you do have the awareness, it empowers you then to go and find the extra income or support that you might be able to get wherever that might be from.
Okay, thank you. Esther, just introduction, then we go to Mwanza to give introduction and experience. Thank you.
Hi, everyone. All the way from Ireland. It's past 2 a.m. here, so apologies for joining a few minutes late. My name is Esther Pepulanolememen. I'm the founder of Sickle Cell Society in Ireland, and I'm very pleased to be here. Thanks to Agnes and Shanta for putting this very powerful session again together. And Jane, I missed a bit of your presentation just before I hand back to you, Agnes. I suppose being a carer myself, I have 2 children living with sickle cell, and professionally I would work in mental health services as a specialist psychiatric social worker. And I would deal with, apart from, the work I do in the community for sickle cell patients as well, you see, there is this whole very massive, piece around financial conflict in families or amongst family systems. And I'm just wondering, I suppose some of the panelists here would quite well agree with me that, that connection between your finances and, your feelings or your emotions, can actually lead to this huge friction in the family. That also, contributes as a factor leading to family breakdown.
Yeah.
And it's very common amongst families living with sickle cell that you find family breakdown, and one parent is left, managing with the care burden of the children and all of that. Now, my question is in different streams.
Yeah.
What's your advice for people, who having two streams of income and they now find out they have a child with sickle cell, and all of a sudden the care burden has shifted from, having two incomes coming in and not even having a child and suddenly having children. Imagine me, I have two children with sickle cell and one with very huge severity. And the whole chaos and the whole conflict in family. Sorry, I'm asking you a question I have to deal with at work, professionally. What's your advice? How do you advise, families to, handle their financial situation before it begins to lead to that point where it breaks down? I'm sure we're having the mental health session, and you can see how all of this is interrelated, the whole emotional feelings around finances and all of that, and all of a sudden the finance is gone in the home, or it's now on one side, and there is huge conflict. The child is in the middle of all this relationship, and there is huge altercation in the family or whatnot. It's a chaotic situation. What's your advice at any stream of, interactional relationship amongst family subsystems?
Yeah, so I think, because I think you said you came in a little bit late. One of the things I said at the beginning was financial stress and anxiety has so many knock-on effects. So I completely agree. Like it affects relationships, it affects physical health. It is a massively, it's a really huge impact on people. And again, I would say a lot of my advice is always, again, on two parts. So it's the emotional, but also the practical as well. And on the emotional side, I would say it's around communication. Communication of, this is a really difficult situation. Are we going to do this together? How are we going to do this together? That kind of thing. But also from the practical point of view, and I know I keep coming back to it, and budgets are not the most popular thing in the world, but understanding what it's going to at least cost you to keep living, and then say, how are we going to address this as a couple, rather than it getting to a point of, oh, I'm getting out of here because it's too hard and all the rest of it, is if having the knowledge of where you sit and what your situation is, to be able to then have an honest and open conversation as well. And I think that it definitely becomes much more of that communication and relationship sort of skills that are involved, but they're equally important. So having the knowledge and having that understanding of what the numbers are is kind of your basis point, and then creating the communication and the conversation around how you're going to do that together. If then it is to a point where then one person leaves the relationship and someone else is then on their own, that's also still having the knowledge of how much it's costing you to live, then enables you to make those decisions. Do I then go and look to get more income from, support through government, and I don't know what it's like in Ireland or in sort of America, but to be able to say, okay, this is the situation I am financially. How how can I then, at least then when you can go and present that to whether it's a charity or the government or wherever it is that you can try and get money from, or to work out with other family members. And again, that's where I talk about the support element, to say, you know, this is a really difficult situation that I'm in, mum, dad, brother, sister, whoever, I need your support, because this is how much it's costing me to live and support my children, and I can't cover my income, my expenses right now. And again, it's that openness and the honesty, but also coming from a place of knowing your numbers as well. I hope did that help?
Thank you.
And this is the difficulty, right, is that these situations, even having the knowledge isn't going to fix it overnight, but it at least gives you the power to be able to make those decisions. And it's doesn't then make everything, you know, wonderful and rosy and fantastic, but it hopefully will take the anxiety off, or at least take the overwhelm of knowing what the next steps might be.
Yeah, I suppose it's empowering for them to know, and if that's a starting point, then, you know, it's a good thing to work with. Thanks very much, Jane.
You're welcome.
Thank you, Jane. I think we'll just take 2 seconds for Mwanza to introduce herself, then we bring in Rachel to do the mental health presentation. Mwanza.
Hi, everyone. Sorry, my voice is a bit rocky. I've got a sore throat and it's so early in this part of the world. My name is Mwanza. I'm a mother to 2 born with sickle cell, and one of them did bone marrow transplant as well. I'm also a founder of Lukumontambo Foundation, which is a foundation dealing with awareness to sickle cell and the like. I'm in Zambia in Africa, and really happy to be part of this. Thanks, Agnes, for this platform, and thanks, Jane, for that information on financial awareness, because it's really important for actually to be reminded over and over about our finances and budgeting and the like, especially that, you know, with raising children with sickle cell, it's like you can't really plan much, because the moment you put up budget, like Agnes talked about, how do you do that budget? You put up a budget, and the next time your child needs attention with a hospital, attention with medical, whatever, and the budget keeps going differently, like, instead of the way you did. So I'm really great. I'm really thankful that I'm part of this. Thank you.
Thank you, Mwanza. Thank you, Mwanza. I think at this point we'll get the mental health presentation, then we'll bring in other panelists also to give your testimonies or contribution. And Rachel, I have your presentation with me here. I'll just share my screen. And can we see which one did I do now?
Number 6.
Are you on the PowerPoint presentation yet?
Yes, let's start on. We're starting on number 6. Yep.
Okay. Did you want to give an introduction before?
Yes, I will. I will do that. I just want to say thank you guys for having me today. My name is Rachel Masiboy. I live in Australia. I have a passion to work with people that are living with chronic diseases. So we've got people. I've worked with people that I have lived with HIV and AIDS, people that are living with other disorders, autism and autism disorders. And I'm a mental health clinician. I am social work trained and psychology trained at the same time. And that's what I do for a living. I work with people that are living with chronic mental illness and also people that live with chronic conditions. So I have a passion for this work. So yeah, and I am here to present about like psychological healing, inner healing for people that are living with sickle cell, and also for our caregivers or the family members that are living with people with sickle cell. And I would like to acknowledge our former speaker who was speaking about finances, and it's a huge thing in people's life, as I am going to be talking about the first aspect of our mental health that we go through when we learn that one of our family members, our brother, our sister, our mom, our daughter, our son is with sickle cell. The first thing that we go through is what we call grief and loss. Sometimes we call that bereavement. So what are we talking about here? We are saying that having a condition for someone with sickle cell, they are already missing out on normality, normal activities in life, and their family members are already missing out on a future that they were hoping to have. When you have your children, you have an idea of what you want to see happen in your children's life, or what you want to see in your family members' life. But sometimes when life throws chronic conditions like sickle cell in our lives, things change totally. So the first thing is that we all go through grief and loss. This is not just for the affected person. Like I said earlier on. So grief and loss, what are we losing? The first thing, we have lost health. So if you're writing notes, it's the loss of health. That's the first thing that we have. And then we've just had a question about loss of financial capacity. That is a huge one, especially for couples and also for the person affected. And coming to terms with that, we call that an adjustment process. And as we are adjusting to the new knowledge, there are a lot of bumps that we hit along the way that might stop us from healing. And sometimes those bumps might allow us to heal. So the first thing that we go through is denial. Those of us that have got children and you're in partnership, you possibly learned that you and your partner or your husband were not on the same page when you first heard about the condition that your child had or that your family member had. People are thinking that maybe it's not that bad. Maybe we can find healing. Maybe we can find cure. And sometimes people don't even want to talk about it. And as a result, you find that our loved one will not get help as soon as they can. And then as time goes on, we learn that the problems are still there and people get angry. So I want to emphasize the anger stage because it affects both the affected and the people that are looking after the affected. So in a family, when we have a family with a family member with a chronic mental health or chronic physical health issue, what that simply means is everyone in the family becomes a carer. Whether you like it or not, you are a carer. But the problem that happens is when the other people are still in denial, you find that usually the mother, that's why this is more for women, the mother tends to carry the bigger burden about caring for the person who is affected. What are the challenges that we need to heal from? The first danger is anger is anger. It doesn't matter where it's coming from. Whether it's coming from a place where, why me, why my child? And the child is saying, why me? We all get angry. Whether someone has provoked you outside, you feel angry. And anger comes with emotions that will be expressed. And sometimes they are misdirected during that time. Those of us that are sitting at the sound of my voice right now, if you are a carer, I'm wondering if there are times when the person you're looking after was very angry with you, or that person is thinking you're interfering with their lives, when they are thinking what you're doing is not good enough, you're getting on the way. And sometimes you get frustrated thinking, I'm doing my best. I've given up all this for this person, but you know what? It doesn't feel like they're appreciating this. The truth is they are adjusting to the process. And as they're adjusting to the process, they are releasing their anger towards you, which is not helping you to heal. So that can be a barrier to healing when people are fighting or they are kind of a bit angry with each other. So how can we overcome this? Those of us that can access counseling, please make sure you do what we call grief and loss counseling or bereavement counseling, so that you can adapt or you can adjust to living positively with a chronic condition called sickle cell. And some people would learn to get help, but when they find help, sometimes they still have a combination of the anger and the denial, then they start to bargain. Okay, if only I could be able to minimize my problem with this much, right? So how do we know we are bargaining? We tend to get every specialist we can get to help us, and I'm telling you that's the right thing to do. That's what we need to do, because with a chronic condition, there's no cure. We have what we call recovery periods. That's what we have. So we bargain, which is okay. But sometimes we are still hoping that when we have the medication, when we have the specialist, we are still hoping that this might go away somehow. And then later on, we learn that it's not going. But we can manage it, right? Some people tend to get depression. Depression, people are sad. Some have kind of given up. You know, this is very dangerous, because when we give up on ourselves, this is when we stop to take care of ourselves if you are the affected. This is when people are no longer taking the medication they're supposed to be. If you're a carer, and if you have seen your family member not taking medication when you need them to do, you might need to check, are they depressed or not? Because taking medication will help them to recover, right? How do we deal with the depressive episode? The first thing is go and see your GP. It doesn't matter what country you're in. Our GPs are able to diagnose depression, and sometimes they're able to give you medication, an antidepressant that might help you and your loved one. And if the GP determines that it's not too bad for him to prescribe medication, then they can help you to find some form of counseling, support groups. Like now, I really want to appreciate the sickle cell community right now for having safe spaces for people with sickle cell in most countries at the moment. And then the last stage is acceptance, right? So with acceptance is like, I've done everything I can do, but sickle cell is still in my family. Now I have learned how to manage it. I have learned what strategies to use. I have learned who I can run to. So now I am just going to accept it, right? What are the signs that you've accepted? With the acceptance stages, you start to experience some happy moments in your life. And there are times when you can now start to put your life in order, where you can start to talk to your partner, you can start to talk to your family members to say, who can also help me in this situation? You are now talking about it. It's no longer your own thing anymore, right? So I emphasized at the beginning that when there's someone with chronic condition in a family, everyone becomes a carer. I just want to let you know that with sickle cell, healing is what we want to achieve, but the honest truth is with sickle cell, we recover from it. So I want you to note the difference between healing and recovering. Recovering simply means is we have learned to manage the condition. We have learned to manage our mental health. That maybe in 10 days, I've got 8 days that I'm happy. I've got 8 days that I can be productive because my loved one is traveling very well. So we use what we call the recovery model. So it's like when you have accepted, you are saying, yes, there are going to be good days and bad days. Okay, all right, let's move on to the next slide. Okay, so those of us who would like to know how they can manage their recovery moments, the first thing is you need to know what sickle cell is all about so you can accept it. So receive psychoeducation to understand the illness and how it's managed. And improved knowledge will always increase your capacity to better cope with the condition, right? And then psychoeducation, like we are doing right now in this platform, these psychoeducation sessions, they will form your support group and also enhancing your motivation to support your loved one or to keep going as someone who is affected by sickle cell, because you are hearing shared experiences from other people. And psychoeducation as well will bust all the myths that are around sickle cell, and it will benefit the affected person and the family members as well. Yes, and those who can access counseling is what we call trauma counseling. It's traumatic having sickle cell, especially when you have episodes where sometimes people are fainting in public places, sometimes they're losing their vision because some sickle cells are stuck in their eye nerves and all that kind of thing. And then cognitive and behavioral therapy is psychological therapy and strategy that you can only get if you see a qualified counselor. And I encourage those of you that can actually visit counselors, psychologists, mental health social workers, mental health nurses. Please go and get some help, especially when you are having bad days. I want to emphasize this again. We recover. There is no cure as far as we are concerned. So those down moments are going to come, and unhelpful thinking is going to come around having a condition. So what we are saying is that your thoughts will always affect the way you're feeling, which is your emotions, and your behavior is always affected from what you've been thinking and what you've been feeling. But CBT therapists will support you to foster pro-social thinking around your condition. And also they act as a reminder of all the resilience plans that you have in place. Okay, let's go to the next slide. Next slide.
I'm trying to, okay, there we go.
Okay, that's fine. That's okay. That's all right. So we are saying that most people that live with sickle cell, their worst enemy is no longer the sickle cell condition. What are you saying? I am saying our unhelpful thinking can be self-defeating in our lives. Because if we are focusing on why has this happened to me? Why my child? Or why me? Or this is all for me, no one is going to know about this, I'm not going to tell people. You are likely to be in those cycles of major anxiety and depression, even as a carer or even as the affected. So go and get help so that you receive strategies to manage your physical pain and also to manage your distress. I would also want to emphasize this once again. Most people that are affected by sickle cell are mostly from the African community, and of course other nationalities, but with an African bloodline, right? But then culturally, we believe that what happens in my house stays in my house. And when people start to know about having a chronic condition, about having a mental health condition, or the anxiety and the depression that's coming to as a result of the condition they have, people tend to keep everything, right? I mentioned psychological trauma on the last slide. I would like to expound on trauma, right? My best way of explaining trauma is explaining it in terms of the physical trauma, right? Does any one of us ever broken a leg or has had a child who broke a leg, right? If your child breaks a bone, right, or if they have a very big cut, we call that physical trauma, right? But because we are seeing blood, we have a tendency to rush straight to the hospital, and we get screws on the broken bones. We get regular cleaning on that wound every day. And then we get bandages and plasters on that wound until they fully heal. At the end, the plaster is removed. But even after the plaster is removed, you may find that that child of yours is still not able to walk. You still need to take them to the physiotherapist for a while until they can walk. So same applies with our psychological trauma. What that simply means is emotionally, there is a damage in our nervous system that has happened as a result of the overwhelming feelings, as a result of the new knowledge. So when we are going through the adjustment process called the grief and loss that I've spoken about, it's like your body is healing from that emotional damage that has happened to you as an affected person, and also as the carer of the person that has got sickle cell, right? So I am saying that keeping things to ourselves is not going to help. We need people to support us for this continuous healing. Sometimes it feels like you're carrying a boulder on your own, right? If it becomes overbearing, right, there are times when it feels like the boulder is about to come back and crush you sometimes, because I can't do this by myself. I can't do this anymore. But we are saying today, you are not supposed to do it by yourself because it's too heavy. If there's going to be inner healing as an affected person, please don't hesitate to see your GP. Don't hesitate to see your counselor. Don't hesitate to see your friends if you can. Don't hesitate to have a circle of people, affected people, that will make a support group, because you are always going to need that for your recovery and for times when you need to come out of that depressive or anxiety period. There are going to be times when you're going to be crying, but there are times you're going to be happy. Right. Okay, can I have the next slide, please? So healing is going to be a joint effort as a family. And for those of us that are in families, you might need to educate everyone in the family that they are also carers. Because if it's all on one person, it means it's going to be emotionally draining. When we spoke about grief and loss, not only is the carer going to lose a child that is functioning or a family member that is healthy. We had a question about losing your finances, right? We all had dreams in life where I want to be a professional, I want to do this, and then sickle cell came. Are we saying having a disability in the family means a death of a destiny? Some people have made it that way, that because we've got sickle cell in the family, so a mom's destiny is gone, or the child's destiny is gone. But what I am here to say, to tell you is, no, sometimes having a disability does not mean inability. But at the same time as well, we need to have we don't have to have an expectation that you're going to function as normal. How are we going to adjust our lives to be able to accommodate all the other things that are important to us? I'm sure some of you here, your mothers, you've got one child with sickle cell, but some children they don't have that problem. Where's their mother? They still need their mom to function properly. They still need to be loved. They still need to be given attention as much as a child with sickle cell has. I have had situations where I worked with a child with disability, but then the other children were now mimicking that younger child, the child with disability, because they thought if I behave like my brother or my sister with a disability, my mom will love me more. My mom will give me more attention. So where am I getting at right now? I am saying it's unhelpful to think that your life now revolves around a child with sickle cell. Please let us get help. Let us involve everyone in the family. Those that are living overseas, and for those of us as well that are even in Africa, with these support groups that you have started, I am suggesting that if you can get funding for respite services, that would be great. So that at least when you're feeling overwhelmed, someone can come into your house to look after your child. Then you can go out and do other things, even if for a weekend, even if for just a day, to go away and do things yourself, right? And with our partners, education is needed so that everyone comes on board. With work, if everyone is knowledgeable and is willing to be a carer, instead of losing your 5 days of work, you can cut down to 3 days of work. And then your partner can also maybe cut down another day, right? So that everyone still feels like they are important outside the house. Doesn't feel like your life revolves around the child. Try your level best to work together so that you are given an opportunity to go and work for 2 or 3 days. And then the other days you're home looking after, then you swap, but at the same time, make sure you also have 1 day that you are at home together as a family, because the other children still needs you. Finances are still needed, not only finances, but also you need to express yourself with all your God-given talents. So let us try and work together. Right. So just to wind off, there are just a few things I want to emphasize before I go. Having a disability in the family does not mean inability. So try and restructure your family life and bring everyone on board, because everyone is a carer. Number 2, you are going to have what we call recovery periods and not cure. It is going to stay, but with recovery periods, instead of having 2 out of 10 days of misery, you might have 8 out of 10 days of joy and happiness as a family, only if you're all on board, only if you're getting help, psychological help, and when you've accepted and you've allowed yourself to process your grief. So all the best carers and all the best our loved ones that are living with sickle cell. We are saying you can build resilience around your condition. Thank you so much.
Thank you so much, Rachel. That was awesome. That was awesome to understand that really this is a process, as you stated in your presentation. This is a process, but we can get to healing, and through recovery we can get to healing, and that is what we're all striving for, just living a healthier, well life. So thank you so much for that information. Very, very valuable information. I wanted to invite Hoxie to share as a seasoned warrior, as she's approaching her 67th year of life and living with sickle cell disease. If she could share, just building on some of the pearls that Rachel just presented to us, if she could just share some of the pearls that she has used throughout her life to stay in a positive and healing mindset.
Thank you very much for having me. And I've enjoyed all of the presentations thus far. And I just want to say that this is so much needed, and your speakers have been really on target. I'm going to start with Jane, what she was talking about, because today my financial advisor called me. We have a discussion 2 times a year, but she called today just out of the blue because we're in COVID and getting ready to have Thanksgiving and all of that. And I just want to emphasize, I retired in January, this past January, and I've had my financial advisor for some time now, and we have been plotting out a course for me. And so I am in a position where I feel very comfortable, and I'm going to be able to do those kind of things that I want to do, that I had planned to do, because I had taken the necessary steps that Jane talked about. I have SS, and so sometimes I'm, down, and sometimes I'm not. And so having a disease which does, you can't plan on, you can't do really any planning, but you can plan to have the best life you can. And so for those people who think that everything is always going to be erratic, I don't agree with that. You can make plans to the best of your ability and then follow those plans through. And that's, I've been able to do that. The friends that I have who have sickle cell have been able to do that. We've all been able to work. And, there are times when we're out of work, due to the necessity of the disease. But, and that's with everybody. Everybody has ups and downs. So I just want to let people know that, don't give up, have hope, plan your life as best you can, and, take those plans and work them out. And I think all of the things that Jane said were just really on point. What Rachel said about mental health, I became an advocate, I'd say probably when I was in my 30s, my late 30s, after having moved to Houston. I grew up in Minnesota, and then I went to the East Coast to go to school, and then I moved down to Houston in 1982. And that's when I started my advocacy work. And when I started that work, I had never heard of people with sickle cell who suffered from depression. That was very foreign to me because I've never suffered from depression. And so the mental health aspect, I think, is very important, and that people address those things that they can, and that we don't stigmatize it like we are wont to do in the US. But I had really never heard of depression, and several of my friends who have sickle cell suffer from that. And, I support them as best as I can because everybody is different. And one of the things that I live here alone. This is my grandparents. My maternal grandparents lived here in Houston. And so that's why I moved down to Houston, to learn from them before they passed away. And so I have cousins here, but we didn't grow up together. So they're not we're not close. So my network, my sister is in Illinois and my brother is still in Minnesota. So my immediate family, we're all spaced out. I don't have those, so that support with me, but I do have friends that provide me support when I allow them to, because I am a very independent person, and that's how I've always been. I've lived very independently. I do the things that I want to do. I'm able to, thank the Lord, I'm able to do those things that I want to do. But those of us and everybody who's on the call tonight knows that sickle cell is a war. And I have had many battles during my period. And I've lost some and I've won some. One of the ones I lost was back in 2009 when I lost my eyesight in my left eye from sickle cell retinopathy. And so, did I give up? No, I kept going. And it's hard for me today to read. I was a voracious reader prior to that, but I finally read my first book from cover to cover last week. And so that was something, I'll get a book and I'll read it. And because of the vision, man-made is never God-given. I had surgery, but it's just not like I had in the beginning. And so it's very difficult to read, but I was able to get through a book finally from cover to cover last week. And so I just plan on, taking it slowly and doing it and putting that back into my toolbox of those things that I enjoy. I just think my mother was a registered nurse, and I think the way that I grew up is I have an older sister and a younger brother. We all had chores that we were responsible to do. I didn't get a pass because I had sickle cell. They never treated me differently. And I think that has also led into my ability to have succeeded, quote unquote, in life and gotten to the point where I am because I was never considered, labeled. My parents never told me, you can't do this, you can't do that. And when I was younger, I actually took, I guess, more risk, and I tested my body to, see what I could do. And through that, I learned what I can and can't do, and I policed myself. But it wasn't my parents saying, don't you go swimming in that lake. Now they would say, my mother would say, if you go swimming in the lake, you're probably going to come back and you're going to be in pain. And of course, that was true. But after 2 or 3 times of that, I stopped doing it because I learned that, that is going to get me in trouble. So I just think that throughout my life, I've been able to take risk, to grow, to do those things that are important, and to, make it to 67. I'm just so grateful to be at 67. I have a girlfriend here and she's 77. And so people do live, we are living longer. There are things that medicine can do, but we are living longer. And so I just think that people shouldn't give up. They shouldn't take the easy way out and say, well, I can't do this and I can't do that. They should challenge themselves and do the best they can. And sickle cell doesn't have a monopoly on misery. Everybody has something. That's what I always say is everybody is dealing with something. I just happen to have sickle cell. And
that's an excellent note. That is an excellent note to segue. Thank you so much, Hoxie. You're right. I believe as well that everyone has something to manage. Right. And I think that what you have spoken to really, really supports Rachel's information and presentation, and it's just inspiring. So I thank you. And it just shows that our community is very diverse. So you have people living different lives. So there's a lot to be learned and a lot to be shared as people do more in this space for sickle cell disease. So thank you. I appreciate your story. We wanted to ask, we're wrapping up here. We wanted to wrap up in the next few minutes, but we wanted to ask, please, that Ma, if you could share a few words, and then we'll hear from Isabella, and then we can wrap it up for the evening, if that's okay with you ladies. Thank you so much. Everyone's been wonderful.
Good evening. My name is Fulu Moses. I have 4 children with sickle cell disease, 2 girls and 2 boys. I can relate to everything that Rachel said. I think for me, the first time I found out that my daughter had sickle cell disease, it was very devastating, because I never knew what sickle cell was. I never knew I even had a trait. So it was a shock to me. And the first thing I did was start crying in the doctor's office. But then something told me, why are you crying? Because the doctor said, your daughter has sickle cell disease. She will not live past age 18. So hearing that, and me not knowing what sickle cell is, and him telling me there's no cure, all I could do was cry. But then something within me told me, why are you crying? He did not create this child. So immediately I knew it was God talking to me. So I wiped my face, went back to him, and I asked, what can I do to help her? And he gave me the do's and don'ts. And I said, okay. My child was 3 years old then. So she could not understand what was going on, except she's in pain. So I had I have 4 more children after her, and 3 of those also have sickle cell disease. And there are times when all 4 of them will be in the hospital at the same time, or 2 going in and 2 coming out. And we managed, but I think in retrospect, it was only God that kept us through. And my family was there because I had 3 other children that didn't have the disease, and sometimes they were neglected. And I didn't know how to handle that. You know, it came a day when one of the boys said, you know, whenever I say I have a headache, you just tell me, go take some Tylenol. But when one of the kids with sickle cell disease said they have a headache, you start panicking. So I had to explain to him that it's because he has a condition that necessitates me being careful, because one of the girls, my youngest daughter, had a stroke at 12. All she said she had was a headache. I never knew that could happen. So since then, when I hear headache, something rings in my head, I start worrying. But we've been through a lot. You know, I lost 2 children 2 years apart. My daughter, the oldest one with sickle cell disease, died in June of 2017. My other son died about 18 months later. And it took the grace of God for me to even be standing, because, you know, I don't want to say to God, why me? Because I didn't know how that happened. The oldest one that died, she traveled everywhere. She did everything. She decided she was going to be a film director. She went to UCLA, finished, graduated, moved to Germany. Even though we said, do not go that far, she said, that's where I'm going, because that's where her husband was. And she left. And people always ask me, even before anything happened, why do you allow your children with sickle cell to do what they do, to go here and there? And I usually tell them, if they are living in my house, in the same room with me, whatever's going to happen is going to happen. I did not create these children. All I can do is remind them of their boundaries and let them go, and just ask God to watch over them wherever they are. And that's what I did. And most of my children, they travel a lot, especially, you know, it's like the ones with sickle cell disease, it's as if they were trying to prove a point. They went everywhere, out of the country, everywhere. And they did things, they enjoyed their lives. So, and I think from the beginning, we had told them, you have sickle cell disease, okay, but it's not a handicap. Because we have people that had, I don't know what disease is worse than sickle cell disease, because it's such an unpredictable disease. But we just let them know, you can be whoever you want to be. You can do whatever you want to do. Don't limit yourself. And, you know, we try to support them as much as possible. So I can relate to everything that Rachel just mentioned. It takes, you know, sometimes it takes over your life, especially us from, you know, a distant place. I came from Nigeria. I don't have any family here. At the time the kids were growing up, I didn't have any support. So it was all on me. I was working full time because my husband was in school. So it was hard. But God, it was God. You know, because today when people ask me, how did you even manage? And I tell them, it was God, because I could not have done it. I could not have survived. And, you know, it's not just me surviving, it's these children surviving. When I look at them, look at the pain they are going through, and then you are going through the guilt of you giving them this disease. You're looking at them, you can't do anything for them when they're in pain except to sit there and pray. Sometimes I will be praying to God, just transfer the pain to me so they can be free. So it's a lot. And, I'm happy to be on this panel. I'm happy for this forum that, we can speak, because a lot of women are going through a lot with children with sickle cell disease, because it's mostly the mothers who are the caregivers. And when the children are sick, it's the mothers they are calling for. At least in my family, my children, I don't care what happens to them, they are calling me, and so, but I just thank God that I'm healthy enough to be able to help them at those moments when they need me. So, and I just, encourage everyone. This is a good start. This is a good forum. We can tap on each other's experience for support, for encouragement, because we all do need it. No matter how old, no matter how young. And I'm so happy, Miss is it Cozy? Yeah.
Miss Hoxie?
I'm so happy for you. I'm so happy for you. And I pray that you live to see your 70s and your 80s and 90s. And thank you so much, Alice, for inviting me. I know our time is fast spent. So thank you so much for having me on the panel.
Thank you so much, Mafulu, for that testimony and just the encouragement. It's so inspiring. I know your story, and the moment that I heard Niemi speak about over a year ago, I just had to connect with her. She's got a powerful story, a powerful testimony, but also to hear it from you as a mom is just so encouraging, despite everything that you've gone through. As you've said, it's God, and I'm glad you are getting their healing, and we hope to bring these forums again in future to just express ourselves. And I think relating to other people and also talking helps. I know it helped me as a caregiver. I have one child who lived with sickle cell disease, but for you to have 4, and unfortunately they are so, rest in peace, the 2 that I've left. But it's all in God's hands. And thank you so much for sharing. Thank you, Rachel. I don't know what happened to my internet. I just dropped off. So hopefully I'm still recording. I hope we'll be able to connect the first part and the second part when I came on board. So thank you so much for your presentation as well. I'm sure it's going to help a lot of people affected and caregivers as well. Hoxie, your story is so empowering as well. And I think this is the message that people need to hear. It's just so reassuring to see that you're almost your 70s now, and you've spoken about your friend who's on that's 70s, also 77. That's a good age. And we have to break all these myths. There's so many misconceptions about the age of people living with sickle cell disease. So thank you so much. Jane, again, thank you as well. For your powerful testimony, presentation. That will help a lot, especially myself. Thank you so much. I think at this point, I'll ask Isabella also to just give her experience and just how she relates in all what we are discussing today in terms of the mental health and financial healing. Isabella, are you still here?
I'm still here, and I've been listening to all those stories, and I can relate to a lot of those, throughout the lifetime of my children. Rachel, where were you 28 years ago when I needed you, I suppose, to understand all of this? I have 3 children. 2 of them have sickle cell thalassemia. 1 of them is a carrier of sickle cell, and you're right. You've got to give attention to all 3 in the way that you're supposed to, and we tried our very best to do that. One of the points you made where you said one of the children might pretend they have sickle cell. Well, that was my youngest daughter, to try and get the attention. She said to me one day, and I was horrified to hear it, and that was, I want to have sickle cell like my brothers and sisters. That then I knew she wasn't getting the attention she needed, because my focus was on the 2 that were in beds, but in beds in hospital side by side, having either eye inhalation or they were suffering from sickle cell themselves. So that was quite difficult. When we were first diagnosed, my eldest daughter was 3, and my youngest at that time was my son, who was 18 months old. Our doctors then probably didn't help with our mental health, then said that within the diagnosis, our children wouldn't survive. So as a young person, as a young mother at that time, getting a diagnosis like that sets in a lot of fear as to, this is not what my life was supposed to be. This was not supposed to be, this wasn't supposed to happen. It was supposed to be a time where we were supposed to be celebrating our families. And we started late with our family. We wanted to be financially secure so that we could spend as much time as we could with our family, growing up with them. But this added extra challenge. Was I depressed? Was I angry at the time? I don't know whether I was depressed, because I didn't understand it. Did I have a support network? No, it was just my husband and I on this journey on our own. In that, with our cultural background, we were both, I'm Italian, my husband's Maltese. It was something that shouldn't be talked about. Don't go telling everyone that this illness exists in your family, because culturally, you're supposed to grow this family tree. Once you start telling people that you have this illness within your family, you won't be able to expand on the family tree, I suppose, because there's a stigma put on that. That was very hard, but I wasn't listening to my family. I decided that I would tell everyone, because with the knowledge is empowerment, whether it's a financial thing or whether it's a mental health thing, it's empowerment. Certain choices can be made. Throughout my life, or throughout the children's life, I always encourage them to do things. I always encourage them to participate in sport, to have a sleepover, to jump in the pool, to go ice skating, all those horrible things that I probably shouldn't have encouraged them to do because of the, I guess the temperature change and all the other things that could have involved with them having sickle crisis. But I wanted them to have a full life, because the doctors, from one doctor telling us that they'd only lived to the age of 5. That was the information that GPs had back then. To then telling us with transfusions they would actually survive to the age of 10. We felt that we wanted to jam pack them with lots of life experiences, and so therefore they had the opportunity to do many, many things. They were never spoiled when they went into hospital. I never bought them a toy, or we made it special, but not every single time we go in. If you're having a sickling crisis, you're not going to get something as a reward. You would have us there, you'd have the attention that you needed. We taught them that sickle cell wasn't who they were, it was a part of them, and learn to live with sickle cell. And they've done that, and I'm really proud of it. Today I can say that they have children of their own. So my youngest grandchild is about 2 or 3 weeks old. And the other grandchild I might have seen before, she was curious as to what her nonna was doing, watching the screen. I think I love listening to your story, Hoxie, because it helps me, I guess, proves that what we thought about raising our children with sickle cell was supposed to be. You've actually confirmed that we're on the right track. Got tears. Depression.
This is a space where it's okay to cry.
I know.
Safe space to cry. So please, it's very cleansing. I find crying very cleansing. So yeah, please.
Going through the hospital, watching your kid experience sickling crisis is really hard, but I could never feel that I had to be weak. I always had to be strong. So they had a sense of security because the amount of pain they were in, no one could fathom. Because as you mentioned before, Rachel, that you mentioned something about if you get a cut, you can see it. You know, if you've got cancer, you can tell. But when kids have got sickle cell and they're going through a crisis, no one can see the trauma that's happening inside. They can only see the trauma on what's happening on the outside. And so it's very hard for any medical person to see what's going on there. So then you've got to be their strength. You've got to give them that sense of security, saying, you know what, we're going to try and help you. Everything's going to be all right. The amount of times that I've said that with both my kids, to give them that sense of security. That was really tough. Always a smile on your face, always making sure you're showing them how powerful and how strong. But in the time that we've grown up with this, I don't think I've really had anyone that I could really, you know, have a chance to talk to, apart from what's going on now about, you know, where do I get the strength from? How do I do this? There was no talking about it or letting it go. Do you know that in this 28 years, that takes a toll on your body? And so I never wanted to go and get antidepressants because I thought I don't want to feel half asleep when doctors that really don't have very much knowledge about this condition, that I was supposed to be looking after my children, I want to have my wits about me. And so I never sought after that. But in that time, my health did deteriorate because your body's going, it's enough now, Isabella, you need to actually find something to find that balance that you need. And I'm learning about that. So I guess at 49, I had a heart attack. I had a quadruple bypass, and I do believe that was a lot from all the depression that I was feeling, or the stress that I was under, mental health, all those kind of things. And I'm sure, I don't know if there's anyone else out there that have had health issues, but that's just from me, myself, trying to manage things, I suppose, trying to be strong for the rest of the family. My husband has been great. He has been my support. We've been together since we were 18. That's nearly 40 years now of him supporting me, and me in turn supporting him, because men are also needing that assistance. But then who can we relate to? And I guess the other thing as well was I'm white. You know, and every time we've gone in there, they've said to us, this is a black disease. And I'm saying, well, please educate yourself, because it's not just a black disease. This affects people from all races. Made me so angry. We all bleed the same. So I don't understand. But that was every single time a new doctor came in to see. That was the other thing as well that disappointed me. I don't know where I'm at now. I guess, Rachel, you're right. Talk to people. Talk to people that travel the same road as you do. I don't know how I've gotten through this, but I have. I was lucky enough to meet that lady down on the bottom of the screen called Agnes, and she's an amazing woman. She really is. She has gotten all of us together. They say the pandemic has had its bad things, but I tell you what, this pandemic has just created a community that wouldn't have been created before. And I thank you, Agnes, for always going, hey, going, Isabella, are you going to come on board? Are you going to do this? Are you going to do that? Thanks for not losing faith in me, and always asking me, come on board, we need you. We need the information that you have.
I think what you say is very true about talking to someone who shares the same experience.
Absolutely.
I find when I talk to, being a mother of 2 children with sickle cell disease, 2 young men with sickle cell disease, living with sickle cell disease, I find when I talk to other members of this community, you don't have to fill in the blanks. It's just a certain language, you know, and it's a relief that comes with that when you can talk and communicate.
Absolutely.
And you don't have to explain, because we all here know exactly what you mean. We know we know what your experience has been like. So I think this community will definitely be invaluable. Agnes has done an awesome, exceptional job connecting the world and sickle cell. So
Absolutely.
we are looking forward to building this community of women that we've talked about between the two of us, our own journey as mothers. And, you know, we know that healing is something that we all need, So this has been just an awesome experience. I think, Agnes, you wanted one other.
Yes. Thank you. Well, thank you so much, Isabella. Like, we are all on this journey, and Isabella is one of the first families here in Australia. And as she said, they never had the support from any organization at all. And me coming on board, we are connected by our clinicians. I'm so glad that we are walking this journey together. But I just thank you, despite everything that you're going through. You've got the courage to actually share your testimony, a very big part of what we do. And thank you so much. We have Eleni also from South Australia, and is here in Australia. She's also a caregiver to one of our girls who's in, let me not call her a girl. She's a young adult in South Australia, Sophia. Eleni is the mother. She's also on the panel. Before I do that, Rachel, you had your hand raised. Did you want to say something to Isabella? You're mute, Rachel.
Okay. No, I just wanted to say something to all of us guys that for caregivers, your mental health is equally important as your child's sickle cell condition, because research, I don't have the figures right now, but research has it that caregivers are at risk of actually passing on before the people they are looking after, if they don't look after their mental health and all their other health conditions. So watch out for your blood pressures, your everything. Please be on top of things in terms of caring for yourselves. Thank you.
Thank you, Rachel. At this point, I'll just give Eleni, before we wrap up, to just also give a testimony or anything she wants to share. Eleni, thank you. You are mute.
Sorry. Hi, everybody. I've had nothing but hassle trying to get on today, and it was as easy as following your link, Agnes. Well, I just want to say that I was pretty lucky in England. I had a lot of information. I had a brilliant hematologist who would speak to us for an hour or so about latest developments. I couldn't get through Sargent's book on sickle cell because of the horrific tales about what could happen. And because of the limited perspective, or not the perspective, but the limitations of medicine, I had to branch off into alternative and complementary medicines in order to help ameliorate some of the worst side effects of sickle cell. Even though I could not pursue a career, I actually pursued a lot of different types of knowledges. And so I've become adept at knowing how to, you know, do aromatherapy, how to massage, how to do homeopathy, how to know about nutrition, know about meditation and relaxation, and all these things that I think mental health is important. And well-being is important, whether you have a person that you're caring for, whether you don't. It's very important for your existence and your life. So I had this perspective to begin with, and I also had the perspective that you're a human being first and foremost before you are anybody that's a caregiver or a person with a condition. So with my Sophia, it was always, no, you're a human being, you happen to have this challenge physically, but you have no less than anyone else. You have all the gifts that the Creator has given to everyone else, you have them too. You have this strength, you have the courage, you have the clarity, you have the joy. It's just your body's a little challenged, and we have to, and look, I made a very bad mistake, and that was to be over protective. You know, don't do this, don't do that, because you're going to sickle. Because if you jump out of school without a cardigan, you're going to sickle. It was, and probably I did that too much, and I'm very sorry about the consequences, perhaps the possible consequences. Although she's pretty courageous, my girl, she is extraordinarily courageous and brave. And we feel very lucky that in Australia and in England, we at least have a blood transfusion, which can alleviate a lot of the crises, and hope that in America and in Africa and other countries where you don't have that, that the advocacy will work towards getting that, because it's so important, and how people live without it is extraordinarily brave. I just salute everybody that does it. Thank you so much for this opportunity. I just want to say that for me, I've always considered the joy in my heart, to be there, and it's there in my daughter. And I think that's what's carried me through, given me the strength. It is difficult for a mother. It's one of the most awful, if not the most awful thing, to see your child in such pain, and to be only given painkillers that you have to administer around the clock for days on end. Somehow you have to find the strength deep within, bring that out, and manage that, because I don't think a lot of the mental strategies are as powerful as accessing your own inner strength. And I suppose if you have someone tell you to do that, that's important. I was just lucky that I had harnessed that from a very young age, and it came in handy, and of course it was like, why me? I'm going grey overnight. But there is a point when you have to actually say, well, why not? This is what happens here, people have all sorts of things going on, and this is what happens. Why did you expect that? Why did you expect anything, So acceptance is very important, and trust, and strength. And thank you for doing what you're doing, because it would have been wonderful 27 years ago to have this support and advocacy, because I did it all on my own. I had more than Isabella, because I was in England and they were a little bit more aware then. They were even aware, my hematologist was even aware about complementary medicine and things like magnesium and things like fish oils and stuff like that. He was actually aware, and kept saying how Sophia was, if not one of the healthiest sickle cell sufferers that he had as a child. So it's very important that we look in those areas as well, because they have things that we can use. So thank you for this opportunity.
Thank you so much for your contribution and testimony, Eleni. And we've got different people sharing, and we are running out of time. And I think this time I'll just give Natalie, our board secretary, to give a vote of thanks before we finish off. Natalie, thank you.
Sorry. Okay. Thank you so much for all of these presentations. Rachel, like Isabella said, I really wish I had a lot of this insight in the very beginning. My warrior is only 7 years old. The beginning stages were hard. Grief, as you said, was definitely part of it. You especially, I found that at the end, when you're pregnant, you expect this beautiful, wonderful child, you have so many dreams, so many aspirations, and having to deal with the realization that you have to deal with something serious is obviously something that no parent wants to ever experience, something that I would never want another parent to experience. And unfortunately, even though it does happen, I would definitely say for the first few years, I definitely felt depressed. I had no support. Also in a country where we were on our own, recently moved to a new country, and having known what I knew from from where I originate from in Africa, having this diagnosis is a death sentence. It's basically, just start preparing your coffin, type of thing, and prepare for that funeral. So having to live with that every day, the anxiety was just mind blowing, for a long time, where yes, you become overprotective, you just, yeah, and you bargain a lot with God, why me? Why is this happening to me? Can this be, can this be a nightmare? And unfortunately, it's not. I would say probably a year and a half into dealing with this, I met Agnes. Agnes again, common denominator. And she has been a great support for me. She really has been a great support for me to the point where it allowed me to accept, even though it was very hard, even for a very long time. It's still a journey. I still feel like every day I still have to negotiate or bargain at some point. And I would definitely say knowledge is power. Once you have that, educate yourself. For me, I felt like if I could understand this condition logically, if I could understand, how it works throughout this body, how it affects the body, that's a one big step for me. Then some of the things that I can help to control for my daughter, if I can do that, that's great. And the other aspect, of course, is the mental. Not just for her, but also for me. And for her, I basically just had to accept that, this is a new normal for us. Just in like someone else might have to deal with their child who might have epilepsy or, diabetes type 1, this was our thing. And with that, for me, the motto is always, thrive. That's what I say, if my child can thrive through this, I don't want her to survive. I want her to thrive. Yes, every day is not going to be easy. We accept that. It's uncertain, unfortunately, and that's what probably brings a lot of the anxiety. But we definitely will not be taken hostage by this condition. At least that's on the good days. That's what I definitely aspire to. So when we have to go into the hospital, definitely try to make my daughter understand that when we have to go there, it's because we need more help from people who actually, can provide it. That means if we haven't been able to manage something at home, we just need to go where we could get better help. I am fortunate, I would say, that we have a great hematologist who is always willing to listen, to engage, to talk about new therapies. At this point in time, I feel much more, I could even say I feel lucky to live through this at the moment, in the sense that I can see that the future is looking better, even though sometimes it really seems slow, but I feel I'm just trying to be really optimistic. And it's wonderful to hear testimonies from Mafolu. I don't want to cry, but I totally empathize. I think we all mothers here, we know how hard it is. No one ever wishes this. And for Hoxie, these are the testimonies that I'm always looking for, for my daughter, that, this is not, it's not a death sentence, it's just something that we live with. Sometimes, we have this box and we have to pull it out. Yes, we have to deal with it. Once it's sorted, okay, we file it away, but, let's accept it and manage it. Yeah. If, so yeah, and I would say with that, attitude is very important. I will say I've been fortunate enough. I work in a field where I'm able to work from home. I'm able to manage alongside. One of the fears that I had when this happened was, will I ever be able to work? Because I know a lot of people, a lot of women who have been affected, where it became a full-time job, and the environment in which they were, did not provide the level of support that they would need. But I've been fortunate enough that my work has always been very supportive. It's a type of thing where I can work from anywhere. I can even work from the hospital. But it's always been, okay, while you're there, you look after your child. Don't even worry about, what is happening. And with her, in helping her live her best life, with this, I definitely make sure that we don't overprotect. We don't treat her like cotton. We don't cotton wool her. Yes, of course, we have to take precautions, that come with this diagnosis. Make sure you always have a jumper. Make sure you can lay her down. Make sure you're drinking enough. All of those things. That she is aware. That she is aware of. And also one of the things that I'm also trying to do with her is that, learn to speak up for yourself, because sometimes I'm not always going to be there, because yes, there have been situations if you are at school and you need to let your teacher know, or someone that, that maybe things are not okay. You need to be able to speak up, because I'm not always going to be there. So yeah, it's a lot, but it's what's wonderful is being part of this community where we are having these conversations, trying to be more open. I must say, sometimes even for myself, I've taken some unorthodox strategies, in terms of how my daughter gets accepted, because for me, it's been important that people get to know her as who she is. She's a person. She's wonderful. She's funny. She's just like any normal child. I don't want this stigma, this label to be put on her first. She is a person, yes, living with this condition, and that's what I want her to carry through her life. I don't want her to, to feel like she is inhibited by this condition, and that she cannot live the best life that she can. Yeah. Thank you.
Thank you so much, Natalie. Thank you so much for sharing your story. And I think we've just inspired each other this evening. This has been an amazing experience. And I thank all of you ladies. I thank you, Rachel, for providing your expertise and your knowledge to give us a framework to heal, to start our healing process. And Jane, I know Jane had to leave the call, but she gave us a framework to start thinking about our finances as a part of our total wellness. So we have some things to think about. And Agnes, and I think you and I are just very pleased with how we've gotten this conference together. We've had a lot of conversations. So we're off to a great start. And where we go from here, we will be back in touch. So blessings. And I hope everyone has an amazing day, night, evening, wherever you are. Thank you.
Well, thank you. Thank you so much, Shanta. And thank you, everyone. This is just a beginning, as Shanta has said. Our hope one day is for us to be in one big room where we can just all share as women face to face. God willing, that will happen very soon. So on behalf of everyone here at Australian Sickle Cell Advocacy, myself, Maggie, Natalie, and Preston, we just want to thank you for this partnership, Shanta, and your team. We hope to do this again in future. So thank you, Rachel, so much for always being able to just give your expertise and help us heal. I know I need that. And we just let Jane know. We also thank you for our presentation and just all the tricks and everything she's taught us today. So thank you, ladies. Thank you, everyone. And we hope to tell you where we go from here next.
Thank you.
All right. Thank you.
Good night.
Good night, everyone. Thank you so much.
Good night.
Bye.
Bye-bye.